Hi, Nari, we can start. You just turn on the microphone and we can start.
Okay. Oh. Okay, we start now.
Yes.
Good morning. My name is Nayang Chang Mathisen and host of this morning's session. I'm the founder of STIA China based in Shanghai, STIA. Let me share a quick screen. We're in the senior care sector, building scalable learning content for care procedures and also covering all chronic disease areas for prevention and management. We have over 300 locally produced short videos that are easy to follow. We are digital health enabler by giving competence to all stakeholders so that the technology can play its intended role and support the elderly population, which will reach 500 million by 2050. Today is the second day of this great digital health forum, which is the fourth edition of the Future4Health conference in China. If you need to understand what drives digital health, please follow us. The mission of Future4Health is to create a global innovation ecosystem to drive the adoption of digital health. We cover all technology aspects which transform the healthcare sector from mobile to IoT, data, AI, blockchain, and robotics. Our global ambassadors connect healthcare communities across the world, providing points of access and share expert advice with the e-health ecosystem to educate and accelerate. A special thanks goes to our premium partner, Healthcare Dialogs, a longtime fellow of Future4Health. Today is the second day event, and we have a fantastic lineup of speakers today. Now we move on to our first speaker, Hong Hwa Pun. I will Okay. Hong Hwa Pun is a German-born Chinese and is a senior digital scout at Boehringer Ingelheim X. Did I say it right?
That's correct.
BI is a German pharma company which works to provide healthcare solutions in the areas of unmet needs for both humans and animals. BI has 52,000 employees globally. BIX is a newly established digital lab in Shanghai. His work focuses on local setup of the lab in China, identifying trends, technologies, and partners. Today, he will share his insight on how 5G will impact on remote healthcare. Here we go.
Thank you very much. Let me share my screen. All right. Yeah. Good morning, everyone, and welcome to day 2 of this awesome conference. I'm really happy to be here. Thanks for having me. And as mentioned, my name is Hong Hwa Pun. I'm part of BIX, and we essentially build digital solutions for our core business in human pharma as well as animal health. We expanded since last year to our Shanghai office here, have 20 talents, about 20 plus talents meanwhile, in order to build really products and disruptive solutions for our business. Yeah, and one of my job, as mentioned, is to continuously look at latest trends and technologies and asking ourselves how these trends actually impact our businesses in future. And this leads me to the topic of 5G and modern sensors in relation to remote healthcare. And I will share in the next 20 more minutes what it means, and at least based on our understanding, in order to see how this would impact the healthcare industry. All right, let's start. with the basic questions, maybe I'm sure everybody have heard about 5G as a term as such, but I realized that sometimes it makes sense to go back to the basics and introduce a little bit, or at least compare what 5G actually means and how this would change compared to previous networks. And a good way to explain a new technology is to look at the evolution of where 5G is coming from. And G obviously stands for generation, and 5 stands for the 5th generation of cellular network that we are getting into at the moment, actually. But it starts with 1, right? 1G was basically the technology that enabled phone calls in the 80s as such. Then we had 2G, which introduced messaging 10 years later in the 90s. Then we had another 10 years later in the 2000s, 3G, which brought access to mobile internet, which was already a significant move in the past. And then 4G, which really enabled and transformed the phone as such as a so-called mini computer, which enabled mobile streaming, data downloads, etc., where you can suddenly could do these type of phone calls or video calls from everywhere. And 5G now can be really specified into some key benefits, such as ultra-fast transmission speeds of larger data streams, including almost unlimited bandwidth, which means that data size and formats would not be a major constraint anymore. If you can think about in future or today, we are facing still a little bit of a delay when we download data, etc., or transmit data, but in future, probably this hurdle we won't have anymore once we can use the full potential of 5G. It is furthermore very reliable, which leads to better and more stable connections. 5G can handle a much higher density of connectivity, also known as massive IoT per square kilometers, which essentially means that you can connect much more devices at the same time that produces data by a factor of 10 compared to the previous generations. And then a so-called low latency, a term called low latency, which basically reduces the delay between sending and receiving information, which will be relevant for all real-time operations, such as autonomous driving, for example. And then lastly, the systems, the overall systems and the new infrastructure with new type of antenna technology will be much more energy efficient as such, as you will have so-called idle times or sleep times of antennas that only connect to devices when the devices are really used and transmitting data. And just to illustrate a little bit what latency is, here a little comic, and I hope that we're not facing, or at least not facing too much of a latency now by showing you this. And I think you understand the point here, right? It's really about the time between setting and command and then the actual action at the end, right? And today, and we all know this, and we all experienced that before through our Teams calls or Zoom calls, etc. When we're trying to share a presentation such as now, there's usually a little bit of a delay between, for example, switching to the next slide or showing a video just like this, and the actual action. And this is essentially what latency is. And in future with 5G, we won't have this latency anymore. And this illustration can actually nicely show that. And what are the technologies which actually enables that? And there are obviously a lot of factors, but drilling it down to the core essentials, it can be clustered as such. So the infrastructure with the fiber optical cable, which basically serves as this nervous system of the mobile network, leading to broader bandwidth, faster speed through light, and the high reliability. This is actually not very new. We already have this with 4G, but in order to grant access and really support the widespread, it's needed to extend the infrastructure of fiber optical cables. Second, we have the so-called 5G, which operates in the high frequency spectrum space. If you look at the electronic magnetic spectrum as such, 5G is more on the right side. which essentially means that instead of 1 to 6 gigahertz, which we have today, you have transmission speeds up to 30 to 100 gigahertz, which is a tremendous jump by a factor up to 100. And in simple terms, the advantage is that you have this greater capacity. You can handle much more users, especially with faster connections. The downside here, however, is that the wavelengths, the so-called wavelengths, are much more shorter, which means the coverage is much more less. Yeah, so you can compare this to in the past, for example, we had these walkie-talkies, right, or simple radio signals which can transmit the signal through kilometers wide. Because the wavelengths are very, very long. However, the information capacity as such is very, very low. And now we have much more faster wavelengths, but the range is much lower. Yeah, which actually leads me to the third point, which is called small cell deployment. And in simple terms, it means that we need much more antennas per square kilometers in order to grant coverage indoors as well as outdoors. So what it means is that instead of having one antenna in one area, which have a continuous radiation of the signal, you will have much more smaller antennas everywhere installed, which basically give you a direct connection to each devices, which on the other hand actually introduces a new technology called beamforming, which give you this efficiency and increase as well as less risk of interference, because you only connect to those antennas directly, which you actually use, instead of having this huge radius of signals where a device will connect into once it's in the range. Yeah, so there's a significant difference in there. In terms of market drivers, obviously, so all these elements I mentioned on top are connected to a quite high invest, right? Which means that this is probably something that is one hurdle which we need to overcome, mainly driven probably by the providers or the governments who need to put this invest and in order to build the new infrastructure that is needed in order to use that. Second, on the other side, providers and users, they actually need to get new types of devices which can handle the 5G network. And lastly, as we're already facing, whenever we have more devices, more connectivity, more data transmission or generation, there's always this notion of security and privacy concerns, which probably will be decided by the users at the end of the day, and then new regulations, etc., will come in order to make it safe as well. Yeah. And then just to illustrate and show you that it's actually already happening. So this is not real. So this is a picture of a park that myself actually took while having a walk with my daughter the other day on the riverside in Shanghai. And I noticed that there was a very strange tree, yeah, or an interesting tree, let's put it this way. And by zooming in, you could realize that this is actually not a real tree. This is one of those antennas, small cell antennas that they place in the middle of a park in order to not destroy the environment or the looks. They basically covered it with Christmas tree-like appearance, and that's quite interesting. And one example how you could actually grant coverage in the middle of a park without destroying actually the environment from the appearance as such. For example, in the city, it's much more easy. You can hide those antennas behind every corner. But then you also would like to grant coverage in more remote areas, let's say, and this is probably one way how you can do that. In terms of 5G adoption globally, there was some interesting stats here, and maybe starting off with the left, dark blue means that 5G networks are already launched. So you can see that in Northern America, Europe, and Asia, especially in China, Korea, and Japan, these are the forerunners in terms of markets which already deploy 5G plus all sort of use cases behind that. And then light blue, these are the countries which just started to deploy the technology as well. And green means that they just about to start to invest to understand and invest in these use cases. And then on the right side, an interesting study here, our survey here with about 150 global IT executives who basically were surveyed and asked what type of industry they think will be disrupted the most by 5G. And turns out that automotive and cloud services will be according to that survey, disruptive the most. Healthcare is still somewhere in the middle. But the key point and the interesting piece here is that the infrastructure and the use cases will be probably done with and by other industries first, and then later on as a nice side effect, actually, as you remember, infrastructure is one crucial piece and crucial market driver to invest in, which will be done by another industry, where the healthcare industry later on can actually tap into and then immediately jump into the benefits and use cases without doing so much upfront invest as such. Yeah. That's quite interesting to observe. And then if you think about autonomous driving as such, and all sort of robotics, which we have in manufacturing, and then the processing, which actually happening in the cloud, which actually makes sense to justify the survey here. All right, so coming closer to our topic as such, yeah, remote healthcare. We were thinking, 5G as such probably won't be a game changer by itself. Yeah, usually, and this is observed by many other topics or big categories which are emerging. It's usually a conglomerate or a so-called convergence of multiple factors that come together. And in our case here, it's 5G, which serves as this base infrastructure with all the benefits I mentioned before. Then modern sensor technologies, I think, as second element, which essentially grants the accessibility and monitoring of a variety of vital data generated by an increased number of IoT devices of the human being. So modern sensors are actually the key to get the information out of the human being as such, in order to transfer that and analyze them, etc., which comes afterwards. And then from the macro perspective, a little bit, the demand for more healthcare services as such underlines the need for remote healthcare as well, driven by, for example, and Nayong also mentioned that, by demographic changes with an aging population, for example. Then it is observed that in probably any region in the world, there are certain healthcare reforms that essentially, if you break it down to the core, says that it should grant access to basic healthcare for everyone. And remote healthcare here can obviously be one channel to do that. And then lastly, and that's probably a bit too unfortunate, we all witnessed that global pandemics. And this unfortunately will not be the last one, which basically require remote healthcare, at least as an alternative to grant stability and as an alternative channel to consume healthcare. And then lastly, a very important factor here is that there's a growing generation called the so-called digital natives, or Gen Z, or everyone born after the 20s, 20 zeros, who are growing up and who are used to consuming all sort of services in a different way. Yeah, be it financial service, be it entertainment, be it the shopping service, and then eventually also be it how to consume the healthcare services. And these group of people, they will soon, maybe 10, 20 years, be one of the main consumers as such, and they will be demanding a different way, probably, as at least as an alternative to consume healthcare as well. And remote healthcare here obviously would play a role as well. They will ask themselves, hey, I have all these digital things. I have my all sort of devices. Why do I need to travel 1 hour, 30 minutes, depending on where you live, to a hospital to see a doctor for 5 minutes? They will ask these questions, right? And then remote healthcare obviously is an alternative, at least for certain diseases, that can help here. Digging a bit deeper into what it means, or how the area could look like. So interesting graph here from Porsche Consulting, and what we observe here is that on the left side we have the so-called lifestyle space, where the consumer is essentially a consumer, and then on the right side, the other extreme, we have the healthcare, more regulated space, where the consumer turns into a patient as such. Yeah. And it can be observed that through digital, through all sort of new technologies, actually these two areas are converging with each other. So there's not a clear cut anymore between the well-being space here, as stated here, and the healthcare space. And obviously, having an infrastructure around 5G and modern sensors would support actually this trend where the consumer suddenly thinks about or starting already being aware of their individual health status before actually becoming a patient. And with these sensors, with the technology and the infrastructure behind it, you can actually do that in a very efficient way. And then on top of that, you will have much more touch points as well between the virtual and the physical world with all these tools that we have through apps and also physical facilities, which actually builds overall a seamless customer experience for the user. Yeah, and one underlying factor here again is having those devices, having those devices slash sensors that are behind that, which actually can generate valuable information about your health status, plus an infrastructure that is actually able to transmit the data, ideally in real time, or be it doesn't have to be real time, just be it the fact that you produce the mass of data, that you have an infrastructure that can handle that in the cloud is already of an advantage. And this is what 5G plus sensors would actually bring to you. If we now look a little bit on the patient journey or the so-called pharma value chain, we can and then drilling it down, what are the key benefits from 5G again? So it's the connection density, which means more devices per square kilometers, right? It is much more reliable as such. And then obviously the transmission speed. We try to see which areas would be impacted the most, or at least where the 5G benefits can be used the most. Yeah. Very straightforward, I think, is the space of disease awareness as well as disease management. So in short, basically the fact that you have tools and technologies that can help you to understand your health status or your therapy status. Then straightforward as well, diagnosis and consultation. And I have some examples later on. Basically, all the space of connecting to a doctor, speaking to a doctor, and then even potentially doing diagnosis at home in future. So here, obviously, reliability and transmission speed is core in order to also provide a certain seamless and reliable customer experience or patient experience to some extent. And then, yeah, in terms of pharma value chain, so here we looked into, so next to manufacturing, where you have all these industry 4.0 topics, obviously, you have the space of R&D where you can now make use of this technology as well as those devices in future in order to design your clinical trials in a different way. You might have new data points, you might have new ways of getting access to patient, because now suddenly you're not necessarily relying on recruiting patients from a certain area. You can actually expand the patient pool with the same quality outcomes as you wish. So the space of research and development here we see the most impacted. And just to continue with this example of diagnosis, so here you can see the teleconsultation that we have today. At least in China, we are quite advanced here. You already can use one of those internet hospitals, communicating with your doctor, either with video text or video text, yeah, essentially, but plus the so-called enablers, new types of sensors, not necessarily sensors which are built in your Apple Watch, but thinking about new modalities, especially non-invasive, you can actually bring this to the next level. Why should it be ideally non-invasive? It's because we go into this consumer space, which is less regulated. And whenever you want a patient to take the blood sample yourself, probably it's getting complicated, right? So that's the key. So new modalities, for example, through your breath, through the way you speak, through your smell, through analyzing your body fluids like sweat, saliva, and urine, you can actually already gather a lot of your health status at home non-invasively. Yeah, and if you combine this now with the teleconsultation scenario, then you can ideally you can do a full-fledged diagnosis already at home without seeing the doctor yourself. And this is the potential that we have that we can go into with the use of new type of sensors plus a reliable infrastructure, which can actually give you this experience that you need. Yeah, because we all face that you cannot do a video call, and everybody hates it when there's a lag behind. And then if you're sick, you probably cannot do that as well. That's why 5G, I think, is so important to grant this. And just to show you some examples, it's already happening as well. So we have those type of health hubs already in the market. So here, an example from Biotom, which essentially is a very small device which you can use to do a basic health check every day. Yeah, what is missing here? It's not transmitting the data live into a cloud and to the doctor, etc. But for this, we have TitleCare. TitleCare, US company, also FDA approved. It's basically having this health hub, but it has these type of tools like an otoscope, a stethoscope, a tongue deep pressure device, where you can which you can call the doctor live, and the doctor can hear the signal what you're doing at home. And in order to provide a good service here, you are required actually to have a stable connection, and 5G here again can help to do that. And this is really, I think, the next level of remote healthcare or healthcare at home, at least at the moment for the basic check. But you can extend that if you have novel sensors which can give you all sort of information, not only step count and blood pressure and your temperature. Maybe you have sensors that can give you much more information. Then this would really bring the disruptive impact that we want. And then there are technologies where you don't necessarily need to have contact with the sensor. You can actually also do this remote, for example, with this company or this startup called Bina AI from Israel, which uses the phone camera to do some diagnosis of your face. And then if you bring this to even another next level, we all don't want to have full-fledged sensors and multiple sensors with you all the time, right? So these type of technology, you can actually integrate it into your daily life. For example, with a smart mirror like this, which we have already in the cosmetic industry to do some face analysis, but then here with doing some health check on a day-to-day basis. I see I'm slowly running out of time, so I need to speed up. So in the space of stroke, very straightforward. Door to needle is very crucial here. So you need to take care of the patient within 1 hour in order to increase the life expectancy. Yeah. So in order to not waste time doing picking up the patient and going to the hospital, you can actually create these type of mobile stroke units, which is equipped with all sort of basic instruments, do a pre-check, and then with the 5G network can actually transmit the data in real time to the doctors who can then prepare all the procedures later on without wasting time. So here, huge potential for stroke. And then maybe I skip this. So just to underline, it's happening a lot in terms of sensor research in academia. So you can look this up later on. And with all the objective to make sensors more sensitive, more accurate, and more reliable. And then at the end of the day, pack this into a device that are integrated into our daily lives in order to do the health check at home, plus 5G, which can then transmit the data in real. The consumer industry with big tech already realized that. Obviously, they are all investigating. So these are all news from this year in how to repurpose their consumer technology into a healthcare application. So that's very interesting to observe, and a strong signal, especially for the healthcare players. Whenever someone cross industry is acting, that there must be something interesting that we, especially in the industry, need to act in future and explore the space, how to play a role in the consumer space before getting a patient in the patient space. Okay, just to underline, since we are doing human health as well as animal health, so the same trend we observe in animal health as well, all sort of sensor modalities, plus the network, which basically gives you information of the well-being of the animals in order to prevent diseases and other outbreaks. And these are some companies, especially in livestock, swine, cattle, and poultry, who does that. All right. That was a quick run through of this very interesting topic, and I think you understood the core. Remote healthcare will actually change the way how consumers would treat their health data and health monitoring all along the whole value chain of the patient journey. And 5G is the fundamental infrastructure that can enable and provide the service and benefits. Okay, with that, thank you very much for your attention, and looking forward to get in touch with some people who want to learn more. Thank you.
Oh, thank you. Thank you, Hong. I learned a lot. I was wondering about all these things. You know, the last couple of years, I was watching all these changes happening. It's eye-popping things, you know, they're happening all over. And I think it's really going to happen, digital health. And I think our company has to work harder so that all these things can actually, you know, play its role at everybody's home, especially a senior's home, by the families and the care workers. They're able to use this technology. So that was that. Thank you so much.
Thank you.
So
have a good day, everyone.
So next speaker is Renee Pan. Renee is, let's see. Okay, Renee will moderate the next session, which is a Smart MedTech Roundtable from overseas to China. Renee is a managing partner of Brink, which is a global venture accelerator with a very hands-on approach. Brink has 18 vertical programs across the world, including healthcare and medtech, and invested into over 160 companies so far. Renee will be joined by two guests, Mr. Zhang Yiqin, General Manager of South China Xiamen C&D High-Tech Group, which is ranked 234 in the world's top 500 in 2020. Next is Dr. Cindy Chang, BD Director of the Innovation Center of High Performance Medical Device of the Greater Bay Area, which is a strategic partner to MedPrint. Cindy received her PhD in biomedical engineering from Columbia University. I think that's it for the introduction, and I hand it over to Renee. You need to unmute yourself now.
Thanks, Nanyong. And hi, everyone. Yeah, thanks for joining us for the roundtable today. Special thanks to Aries and Cindy for joining the roundtable today. It's really excited to have both of you to share some insights about MedTech in China and what you do in the space. Yeah, so could you make a quick introductions about yourself and what you do? Maybe we can start with Aries.
Good morning. Good morning, everyone. My name is Aries Shin. I'm glad to see you all here on Zoom. I'm working on supply chain operation and management, and I have been working in this sector for 12 years. And our company just introduced Xiamen C&D Corporation Limited. It's a listed company ranking 224th 34th in the 2020 list of Fortune Global 500, whose main lines of business include supply chain, urban construction and operations, tourism, medical and healthcare, and investment in emerging industries. Thank you.
Thanks, Aris. Yeah, maybe Cindy, can you also tell us a little bit about yourself and what you do?
Hi, everyone. My name is Cindy Zhang. I'm from the IHM GBA, which stands for Innovation Center of High-End Medical high-performance medical device of the Greater Bay Area. So this Greater Bay Area actually refers to the Guangdong, Hong Kong, Macau Greater Bay Area of Southern China. We are an incubator slash investor slash strategic partner for innovative high-end medical devices. Currently, I work as the BD director of the IHM GBA and continuously looking for startups and innovative medical devices in China and worldwide to bring them to the center. So just a little bit about myself. I obtained my PhD degree in biomedical engineering from Columbia University, and I have more than 10 years of experience in biomaterials and implantable medical devices. Before joining IHM GBA, I have worked in R&D as well as international marketing for medical devices. I would like to thank the organizers for providing me this opportunity to join this roundtable. Thank you.
Thank you. Thanks both Aris and Cindy. So like sounds like you guys are coming from like a slightly different background, but working on the medtech, working on the field like very closely in the past many years. So I've got a few more questions. Would love to get some of your insights and thoughts from you. So maybe we can start with like right now we're still during the COVID-19, we're still during the pandemic period at the moment, but what are the actually like what are the trends or new opportunities that you see after the COVID-19 in the medtech sectors in China? Maybe we can also start with Aris.
Okay, thank you. This is in fact a frequently discussed question recently. First of all, for China market, a reliable and stable prevention and emergency response system for pandemic should be rebuilt. This is for sure. And this is a chance for a lot of medical and technological companies to explore new markets and gain an incremental market. Secondly, after the COVID-19, more and more people and consumers care more about health than before. So products that can really improve consumers' health condition will earn a good market and reputation. And those companies who produce these products can also expect a good financial return correspondingly. And also, after the COVID-19, biopharmaceutics will usher in their springtime, and it's obvious in the stock market already. And so a lot of enterprises in this industry have accelerated in their investment in R&D for new products. So in my opinion, this is opportunities and trends for the after COVID-19 market in China.
Awesome. Thanks for sharing. And so maybe Cindy can also like give us some of your thoughts.
Yeah, so as Iris have already mentioned that, first of all, I believe that everyone sees the very fast development of medtech companies that have COVID-19 directly related business, the manufacturers of medical gloves and masks. Also, right now is a great opportunity for the IVD companies. Many of them have higher than expected income in the past 2 years, and we see that also in the stock market. However, I believe this could be changed when COVID-19 ends. It could be hard for them to maintain this high growth rate, so they need to find new areas of development for their business. Another opportunity, I believe, is in the environmental control and contamination control of the hospital. It has always been important, but COVID-19 makes it even more important and higher requirement with more precise control and containment requirement. So this not only refers to the use of disinfectants and wipes, but also services and technologies related to it. We see that robots that could have reduced exposure and transmission of diseases have been used in this space, and I believe this trend will continue even after COVID-19 has ended, just because now people have higher awareness of these conditions. So another area of great potential, I believe, is internet diagnostics and services. With the fast spreading of 5G infrastructure, telemedicine is becoming trend even before COVID-19, as it could help to even out the resources in the remote and more developed regions in China to even out these resources. So with the need of avoiding unnecessary visit to hospitals, telemedicine is becoming more important during this COVID-19 period of time. Also, we noticed that services for medtech companies, such as exhibitions and conferences, are actually experiencing this new online mode, as what we are having this roundtable online. And also, for example, last year, Medica, the biggest healthcare expo, was actually held virtually. This year, there's a combination of online of offline shows. So, we believe this is going to be the new norm even after COVID-19, because now people have realized, the convenience for having these online conferences and expos.
Perfect. So yeah, exactly. That speaks perfectly about today's situation that we're hosting this online right now. Yeah, I do see like more awareness, like more like being able to get health cares like through virtually, and definitely like companies working on health industry or the medtech area are getting more opportunity. Yeah, so thanks for sharing both of your thoughts. And I would also like to get this chances to maybe for both of you to give us a little bit ideas like what you see comparing. How would you compare the market characteristics and the innovation characteristic in the medtech field between the overseas and the China market? What are the differences? Like I know, like Aris, you work on more like on the supply chain side, the market side. You probably like get some sense of that. And Cindy, you work on the innovation area more. And then yeah, maybe you can give us a little bit more insights, like what you see the difference between the overseas and the China market in those areas. Maybe start with Aris as well.
Okay, thank you. For market characteristics, actually, first of all, social and cultural environment is different. This is obvious. So for China market, consumers are open to new emerging products and ways of living. They are open to accept new things. This is great for newcomers into China markets. But they also care more and more about the quality of products and the sincerity of the suppliers. And China is also a typical high context culture market. This is something we need to pay attention to. Building trust is a critical job for a supplier. And for another thing is that for the decision-making procedures in China market, it will be longer. We have to admit that there will be a survey before making a purchasing decision, submitting purchasing plan to the higher level for examination and approval, and then confirming the fund for the purchase is ready, and then we can launch bidding activity under the principle of just, fair, and open. And we also need to consider about the company who is bidding for a certain devices, that you need your background, your qualification is very important during this process. And the product itself, of course, is very key. And for supply chain in China market, it also has its own characteristics. For coastal cities, for example, the Great GBA, the Great Bay Area, is much easier to reach, and the logistic systems are relatively mature. So, but for those inland cities, it's different. So should we keep our factory out or just produce in China within the market? Localization, all this should be considered. And how can we build our own distribution network? And all these questions should be discussed and answered before we consider entry or something we need to consider about China market. This is unique and its own characteristic. And according to different products, different sales model may also be considered. Some products should be sold directly by manufacturers, but some others should be sold through dealer model. It depends on different situations. One more thing I want to mention is that the market emphasize more and more on sustainable development and energy efficiency. And that is the market characteristics that, in my opinion. Thank you.
Thanks, Aris. Yeah, Cindy, maybe you can share a little bit on the innovation perspective. Like, what do you see the difference between the overseas and in China market for innovation perspective?
Yeah, sure. So Aris focused on kind of the end stage of medical devices, which is, sales and marketing and entering into the hospitals. So I would like to share a little bit more about kind of the beginning, the R&D stage of medical devices and innovations. So first thing that we notice is really kind of two different approaches. I would like to refer in China as a top-down approach for innovation. So which, in which the government—
Recording stopped. Recording in progress.
Have, have guided certain directions for innovation. And, is in the 5-year plan of the nation's 5-year plan. They have certain areas, not only in medical device, but in other areas. So those are guided by the government, and they have provided support for it. And most of the innovations come from universities and hospitals who kind of get this advice in terms of which direction to go for innovation. However, I think at this stage, the support from the hospitals and universities are actually not matching up. This actually, I guess, is related to how the KPI of the surgeons and professors are being calculated in China. They have certain requirement for publication, but they don't really have any requirement in terms of innovation and also technology transfer of these innovative ideas. And also there's lack of support in terms of teaching them how to transfer from, say, a professor or a surgeon to entrepreneur, which is, there's a, I believe there's different requirement, different characteristics they have to have. So not many innovation have been transferred to real product or transferred to startup companies. But in say, like internationally, what we see in the States, in Europe, in Israel, I would refer this as a bottom-up innovative approach. Usually is, an engineer or a scientist who have an idea, and they will work on getting this idea and get this into a startup and transfer this into medical devices. And also the support, I believe they have a better support system from the university and from the hospitals. In the universities, they have classes to support technology transfer, to teach them how to become businessmen, how to become what resources they will need to transfer their innovative idea into real products and to transfer them into companies. And most of the big universities who is known for innovation, they have a very supportive system with technology transfer offices, to find potential collaborators for the professors, so the professors themselves can really focus on innovation. One of the example is Stanford University. They have a very good system to support innovation and technology transfer, and they're making a lot of revenue every year for technology transfer. So and also I believe the other thing that is different is really in the way of exit. So most of the overseas startups that we find really focuses on one certain product or technology and working on improvement of it. And especially, you know, for example, the Israel companies, they have maybe just one single product and they're working on that. And most of the time, their way of exit is to be acquired by larger companies. Then the owner or the inventor of the technology, they might move on to the next innovation and to form a new company, etc. Move on with this kind of mode. So in China, most of the companies that we see, they really want to grow larger and eventually go for IPO. So you will see a lot of small companies whose owner is experienced in innovation in the overseas companies who have already been successful. So the continuous entrepreneurs, but you don't really see many of them in China. So, you know, those are the differences that I have been noticing comparing to Chinese and overseas innovation kind of approaches.
Thanks, both of you. That's really, really great. I think like we got some more tips, like if someone want to entering the China market or someone is working on the innovation in such a space, and then what would the difference in between the two different markets? Yeah, so I would actually love to dive a little bit deeper into each of the topic, because I know that areas that I know your firm has helped a lot of enterprises come into the China market in the health and medtech space, including GE, Thermo Fisher. Could you share a little bit, like a little bit more on what challenges is that you see usually for international enterprises coming to the China market, and how could you help them?
Okay, thank you. Yeah, of course, the China market is attractive to a lot of enterprises, no matter what class level or those average. And the China market is an open market, with, as we just discussed. We welcome all good products and good companies, good services. And just in last week, the finished China International Import-Export is a good platform for all companies and products who want to come to China and to explore their market here. However, when considering entering China markets, we may discuss entrance strategy and competitive strategy. Generally speaking, social and cultural difference is the first challenge they may face. But these problems won't be those obstacles. I believe their marketing team are able to solve these problems. However, we have to also do industry analysis, considering about the suppliers, buyers, potential entrants, substitutes, and competition among the existing rivals. This step cannot be avoided. Whether we should choose a lower cost or differentiation as our competitive advantage, because a lot of products now have similar function and the technology is also the most cutting edge. And their branding and communication job is doing quite well, I believe. So one more thing left to do here is to lower the cost. Lower cost may enhance their advantage in market exploring. For our company, we mainly help our partners fulfill their business with lower cost and higher efficiency to make some business that looks like impossible possible. Because we are specialized in investment and operations of medical supplies and medical devices and sporting industries. We can provide medical device supply chain services, centralized procurement of medical materials and hospital logistics management services with customized NIFT supply chain services. Here, NIFT is our supply chain operation brand. L stands for our logistics system. We have our own logistic company with lower cost. So we can serve our customer with no cost, but not no end service. This is different, totally different. Okay, and why we can do it? Because we can integrate our logistic resources and manage logistics jobs at all links of supply chain operations for customers. And I is for information system. This is easy to understand. Integrate our information resources, provide supply chain information and solutions for our customers. And F is for finance. We can offer finance support during the supply chain in a customized way. For example, customize the credit trading products, financial needs and release, financial hedging, structural financial services, and financial channel services, settlement risk management and exchange rate management, and so on. And for T is for trading. We can integrate commodity resources and market resources, provide full chain business service for customers. Three major core tasks of NIFT supply chain services are to integrate resources, plan solutions, and run services. Based upon these essential elements or services, our company integrates 5 major resources known as logistics, information, finance, commodity, and market, plans and supply chain solutions, and provides operation services for our customers. There are a lot of examples we can list for this kind of services. But because of time is limited, if we are interested in this part, we can discuss further later. So this is about my opinion about this question you just raised. Thank you.
Thanks, Aris. Thank you. So maybe, yeah, like I would also love to hear a little bit from Cindy. What's the you share a lot of the differences in between the innovations in overseas and China, and I know you work with actually both, like both international innovation companies and also domestic innovation companies in the MedTech space. So what's the upcoming plan for you in the MedTech industry, or maybe for the GBA high performance innovation centers that you're working on? So what's the upcoming plan for you have in the MedTech industry?
Sure. So actually, Aris have shared his experience with more matured companies, how to enter the Chinese market. And the logic is really similar, as we provide systematic help to innovative technologies and to help them to enter the Chinese market, or to enter the market. So the goal is really to bring those innovative devices to China to benefit both the patients and surgeons here, and also to increase the overall value of the overseas company, because now they have access to the Chinese market, which is a very large market, as everyone knows. So we spend most of our time on international and overseas company and products. So we want to bring them to the Chinese market, but not just as a distributor, because as a distributor the relationship is not stable. You could be switched out. So for that we have so we really want them to have a successful market in China. So we have a strategic partner which is called MedPring Regenerative Medical Technologies, as Renee has mentioned at the beginning of this session. So this is a public company who is trading in the MSE board of Shenzhen Stock Exchange in China. They are one of the leaders in 3D printing and additive manufacturing, and has a complete product line in neurosurgery. So for kind of development of medical device, from R&D to regulatory support to clinical trial and to sales and marketing, which are the elements that are required for the new innovative technologies to be successfully enter the Chinese market. And we know the importance of these resources and help to bring this to the innovative companies. So with the help from our strategic partner, we can provide support in terms of the facilities, for example, shared lab space to those companies who actually goes to the innovation center, so they can perform those tests in-house, because those tests are required for you to get approved for those medical devices. If you go with third party, then the timing and control is really is out of your control. So we prefer to have those in-house support. We also provide consulting services for for regulatory and clinical studies with the help from MedPring if it's related to implantable medical devices. And we have another strategic partner who is a CRO who has more experience in a wider spectrum of medical devices. And also, if the startup wants to bring manufacturing facility to China, we also have space here in the Innovative Center, and we provide support to help them to really set up the manufacturing facility and to get certified for ISO and for GMP in China. Always the help from our strategic partner, MedPring, because they have already have this experience and they want to share their experience through us and to make sure those innovative medical technologies could be successful in China. And for the Chinese companies who had innovative ideas or the inventors, we provide services which is similar. And our goal is probably go and find a couple of partners in terms of universities and hospitals here in Guangzhou, and to establish a startup, a collaboration relation starting from the source of innovation. So we can bring them, we can teach them, we can help them, and we can work together to transfer innovative tech ideas into medical devices and to be successful in the Chinese market. And finally, we'll also provide funding to those companies, because we know sometimes they will need to have enough money for the ideas to be tested and make sure the prototype works, then we can move on to the next steps. Also, because of time limits, I have some examples, and we can talk in more details if you are interested in kind of knowing more about the Innovation Center and want to work with us.
Thanks, Cindy. Thanks both of you. Actually, it's been amazing. Like you've helped to provide a lot of like insight, thoughts, experiences, like not only like for helping the enterprises, but also like the startup companies. So I think that would be like very helpful, and hopefully helpful for some of the audience today as well. Because of the time limited, like I would love to chat with you more, but maybe after the roundtable. But I hope everyone enjoy the contents today for the roundtable, and thanks both of you. And now I will pass back the stage to Nanyong, and thank you very much. Thanks, everyone.
Oh, thank you. It was amazing. My 2 cents from the industry point of view. If you think about the China public hospitals, over 60% of the patients are elderly in many cases. So any of the future, innovation should keep that in mind in terms of user experience. I think that's one area that China should work a little more on. Also think about all the elderly who have more than one disease. They might have 3 to 4 multiple chronic disease syndromes. Therefore, we need to think holistic. You cannot expect that seniors will use multiple gadgets or applications. So that is something that I would like to ask the innovators, young scientists who are working very hard to think about. So thank you. And I will move on to our next very exciting speaker again. Adam Tang is a Vice President of Q Health Trusted Doctors. Q Health Trusted Doctor is a strategic layout of Tencent HealthCare division. Tencent Q Health Trusted Doctor is the largest healthcare platform which has been able to implement online and offline combined healthcare services. Their focus is on high quality service to everyone without being high-end. Adam's personal vision is to utilize his over 10-year healthcare investment experience to bring operational excellence. Here we go, Adam. Welcome.
Hi, thank you, Nayeon, and it's nice to catch up with you all guys here. So today I just want to share our opinions regarding on how to provide accessible, integrated online and offline healthcare ecosystem. So let me share my screen. Wait me for a second. Okay, can you see this? Okay, so wait me for a second to achieve. So I'm Adam Tang from Q Health Trusted Doctor, and I just introduced. So I'm just quickly try to give you a very short introduction regarding who we are, and then I want to use our example to share with you how we achieve the accessible integrated healthcare ecosystem to everyone, providing a high quality healthcare service. And then to share you some opinions regarding on the industry opportunities and the innovation models we've developed. So quickly, the first image I want to establish is so Q Health Trusted Doctor is already the China's largest primary care service provider. Well, we are part of the Tencent HealthCare division, and also we're providing the one-step, the healthcare solution to everyone. So the first image I want to say is offline. We are already the China's largest primary care service provider. Now we have over 100 different types of medical institutions covering all tier 1 and tier 2 cities in China for total like 16. So we covered like Beijing, Shanghai, Hong Kong, and Shenzhen, Guangzhou, of course, all the tier 1, and then Nanjing, Chengdu, Hangzhou, Shenyang, Chongqing, etc. The most indeed tier 2 cities in China. And when I say we have all 100 kinds of different types of medical institution, I mean, we have built up a very large system. We have built 3 lines. The first line is was the primary care. So we have built the like 100 or 200 square meters community centers, which just in the community to cure the nearby families their any healthcare needs. And also we have like 20 to 50 square meters small corporate clinics in the companies. So these are serving for the business partners how to help their company to serve the employees, make the employee feel a better healthcare ecosystem. And then we also collaborated with the government. They also providing us community medical centers to collaborate. So we have this medical center model to serve the government specialized like community populations. These are more like based on the government contracts. And also we have another type is collaborating with the large business insurance companies. We have built up the so-called better fancy medical centers serving the insurance customer. So this becoming our primary care ecosystem, which is our main traffic portal. When I say traffic, these are different types of medical institutions. They are serving for different purpose. Like for the small community medical centers, one center can serve in the nearby 10,000 families. And one cooperating clinics, though they are very small, but each corporate clinic, they can cover around like 2,000 to 5,000 employees. And the community medical center collaborating with the government, each one, we will have 80,000 like operation visit, medical visits every year. And then for the insurance customer, they also catch the insurance customers' traffic. So each one to us, they're becoming our very large traffic portal to have the people to come into our ecosystem. And then based on that, we have built up the specialist care, which is dental and eye clinic, and also the traditional Chinese treatment center. So for this part, they are our interest generation model. Each one is one sustainable business model approved in China market. So this one can generate higher interest rates for us. And then we also focusing on the large day specific treatment for surgery and for rehab. So this is becoming our primary care, and we have built up the one-step solution here. And also the second image I want to establish is for the online part. We are also building up the largest doctor and patient relationship management platform. So currently for our online platform, we are already serving 450 physicians using our platform to manage their patients. Here, where I say why we focusing on the doctor-patient relationship is all our things starting is not just from nowhere. We started from doctor's opinion, because we think in China, what is the key problems there is the doctor, they are very rare. We only have 2.6 or 2.8 million physicians now in China, but we have 1.6 billion populations now in China. This is the not matching number. So what the doctor needs, it was more important. If we can serve doctor better, the doctor will serve their patients better. That is our idea and the key decisions here. So this platform has the focusing on the doctor's needs and on the what they can help them to improve their efficiencies, and then build up the online platform to help them to manage their patients. And now for our online business, we can separate into three segments. One is for the internet hospital, for the online consultation, e-prescription, and then we have the online medication department, which also serve using the medication to solve most of the easy symptoms and the easy diseases. And also we have the healthcare related e-commerce that become our main business partner for the three parts for the online side. And here I want to mention is why we say the internet hospital and have to integrate it with the model we have built for the offline. So for the offline, we have primary care, specialist care, and surgical and rehab care. And before that, it was the internet hospital, because internet hospital, it really can reach every person in China. I mean, can reach every traffic in China. They are the very deepest routes can cover the entire China. So it really extended the accessibility of the every people to attach our service in the China nationwide. And then we have the primary care system to cover the main cities in China, and also we have the specialist care, the surgical care, and the rehab care. So that become the entire ecosystem on the underlying internet hospital, then primary care, then going up. It was the idea why we do this. So what we have built, it will be probably very still a concern for everyone. So that is we combine the online one and the offline one. We become the largest one-step integrated healthcare ecosystem. So what does that mean? It means in two different ways. The first way, where we say we are focusing on the integrated thing, is we are not doing this just because we want to try this, we want to try that. It was based on the needs for our users. So as I mentioned in the main beginning, when we try to get into the industry, we find the key problem was the lacking of the doctor. And more importantly, though the doctor is so rare, they are treated unfair. the doctor, their fee, I mean, their salary is extremely low. But one doctor, they need to be trained in the university and in the school for around like 10 years. And then they need to be trained in the hospital for another 10 years. And then it can be a probably, a qualified doctor. But at that time, their salary is probably just reaching the first year salary of the financial students' financial area. So that is a really unfair number. We focused on this point. We try to solve how to help doctor to achieve their value. So from probably 7 years ago, we have built up the online platform, which is becoming a follow-up platform for all the doctors, try help them to use our platform to serve their patients. So we give them an idea. The patients for the public hospital doctors they treat every day in the hospital can be their personal personal assets or personal resources. So they need a platform to collect. So we, from this point, to help all the doctor to how to save their time, how to improve the efficiencies. We designed a lot of automatic solutions when the people meet the doctor in the hospital. That is the point one. It's very unique for different and from other platforms, other competitors in the industry. We want to the first scenario is happening in the offline scenario in the public hospital system, because that is the thing we really difficult for the online platform to achieve, the trusted relationship. In China, when the people try to find a doctor, they are not easily to just trust any doctor. We don't have a family doctor system in China. So it's very difficult to let them just find a doctor online, but they are easily to find a famous local hospital. Normally, we just go to the 3A nearby. That is the normal Chinese people's idea. So that is the basic trusted relationship based on the hospital's name. And if the doctor and the patient were met there, they met there, and the doctor, after the doctor treated the patient always wanted to have a connection with the doctor. So the doctor can use our platform, have a QR code to let the patient to scan this, and they will keep in touch on our platform. Not by like the doctor's personal WeChat, because it's privacy. The doctor also do not want to share all this with all the patients. But through our platform, it's in the biggest way to help the doctor to keep them in personal information be well secreted. So using this, they can be connected with each other. And for patient's point of view, the doctor from a public hospital he trusts, it serves him for better and for longer. After he going home, it will be like automatic messages from the doctor's name and sent to the patient, and the patient feel the doctor still cares him. That's very important. We try to build up a relationship between the doctor and the patient, and each person, they can trust each other. That's the main idea. And the doctor always can select a lot of automatic solutions, a lot of data trees, a lot of data models, etc. They can send this to the patient, and the patients can answer all these questions, and this can help the doctor to better evaluate the patient's overgoing symptoms, and if there's different questions or that. And these generate our first business model. It was the healthcare e-consultation, and it involved itself to online e-prescription based on the government new policies. And because of that, it was a big step. It means if we have the e-prescription, now we can sell the medication for online part. That is our very important decision or important finding is for patients, what they want is not just talk to some doctor, not do some consultation is good enough. All the patients in the worldwide, they just wanted their disease to be cured. So you have to find a way to actually treat the patient. So while online medication, it will be step one. because through this, at least a lot of like chronic diseases or some ED symptoms, ED diseases can be treated now by e-prescription, and then we can deliver the medication to all the patients, and then it generates our the second online business becomes the e-prescription. And based on that, we think we find the need from the patients and the doctors, and still there's a lot of diseases cannot be just treated by medication or just from some consultation. They have to touch, they have some physical meeting, that's important. So our, well, we made another decision, so we involve our business from the online part to the offline part. We have built up the offline clinic centers. The first thing we have done is we opened a lot of like day surgical centers in different cities. That is two innovations in China. The first innovation is day surgical center itself did not exist before we do this in China. Now we have opened a new industry for the day surgical center, which has already been approved, like in America, in Canada, in Australia, all these countries. Most of the surgeries, like 70% to 80%, was done in small surgical center, not done in the large, big hospitals. Because of the large, big hospital, they have very important resources. They need to focus on big diseases, not the small surgeries. So this is the first innovation. Now we already have 11 day surgical center in 11 different cities. Well, we are already the largest day surgical center chain in Asia. So that is what we have, the first innovation we've done. The second innovation is, as I mentioned, we wanted to provide it to our doctors for the online part. They can have an actual place to work. So this is our new business model. We call them like the medical version we work. We opened the hospital, we opened the day surgical center. We provided all the places, the licenses, the equipment, and the nurse team, the medication, everything the doctor needs. So, but the doctor, they just treat us like we work, like we have a list for them every day. If they need anything for treat their patients, they just select. Okay, they need to book the surgical room for 2 hours. They need some medications. They need some nurses to help them. All these things they just select, and after they select, they book a time and they have their patients to there, and they will finish the surgical service there. That become our business model. We serve around each city. We use this business model to serve the entire city's doctors. They can have their patients to actually meet them and actually treat them and do surgical service even, and in our surgical center, let the patients actually to be treated. That is how to serve the patients better. And based on that, we generate we try to get into the primary care system, because we find we cannot just rely on doctors' patients. We also need to find them more patients. So we have building our primary care system from the clinic to the corporate clinic to the insurance customer, and to collaborate with the government. So for all these different portals to try to get the new patients and give back to the doctor to link with each other. And then we go to the specialist center area to build up the eye clinic, dental clinic. All these just improve our interest level, profit, make us more profitable. So that generally become our entire one-step healthcare service platform. When the patients even still a volume, they can talk to our doctors online, or they can buy some medication. And if they have further needs, the family doctor serve them, can guide them to our different types of offline medical centers and to be treated there. And actually we can cover most of the disease, because we now can do the surgical treatment. It will generate at least 70% of the disease can be treated in our ecosystem. So let me just quickly summarize what we have done, and very unique in China is the first, we have already built up the largest offline network covering all the cities, because then this is for considering which is important in the industry, the payer. The payer is normally the insurance buyer or the national social insurance all over the world. For the medical service area, it's always the final payer, any of the government or commercial insurance. So what they need a standardized service provider. So now, at least in our all 16 cities, we can provide a standardized service. That is why now we try to do more. And the second unique is still, as you can see, we are now positioning us into a high quality international standard service level. But here, as mentioned several times, we are providing high quality service, not high end. We are not Yunnan families, we are not Parkway. We providing all these services. This is all actual photos for our the offline business. So when I say high quality service, we mean we providing the service with better quality, but not heavily investment or heavily luxury service. These photos you can see, it seems looks very better, but actually the investment for each clinic is be very strongly controlled. We are probably the lowest bottom line for the industry. We try to generate more profit for our patients and for our doctors. So that means you cannot invest a lot to the decoration. That doesn't make sense. The third thing is now the very unique resource we have is the doctors. So currently we have 450 physicians serving online. And because of our very unique business model, for the online part, we can say it's a doctor version Taobao. And for the offline, we are the medical WeWork. So all the doctor, if they come up from the coming out of the public system, they try to do their own business using our platform as their best choice because we are saving much of the cost for them. So all the doctor groups now, they collaborated with us from the Dr. Smell, the Gong Xiaoming, etc. These are very leading doctor groups in China, and we serve all of them covering all China. Of course, we also developed some new devices, try to using technology solutions to help the doctors and help the patients. So what I have mentioned is we have built up the ecosystem from the primary care to specialized care and to surgical care. That means we can cover now 70% disease treatment. That's an important thing I have mentioned several times. For the patient's point of view, what's important? My disease is be treated. So that's important. So that is what we have done. And anything beyond our service, that's not our area. We don't do any large surgery. We don't open any people's head or etc. So this is need to go to a 3A hospital. Then the patients can use our online platform to access to the 3A hospital and to and to try to find their treatment there. That is what we have built. And so the last thing I want to mention is still I mentioned that we are focusing on high quality, but the price we are trying to while providing the patients a fair value. Now our value is our pricing system is probably similar or try to close to be the public hospital price. And there's a lot of people sometimes they will ask why it's possible. Well, it's definitely possible because we are not the large hospital. We don't build a very large place. We don't invest that much, and we don't have very expensive and fancy equipment. We just try to make everything just profitable. Try to make every equipment just proper for the surgery. And everything we do here is small surgeries, small disease treatment, and it's like a chronic disease. It doesn't cost a lot. So that means we can providing to our patients a better price. And that is why we are accepted by the social insurance ecosystem. And still in China, I think they are the main player and they are the main payer. So we chase on the social insurance and try to be acknowledged by them. That is our key unique figures we have already done. So, well, finally, let me just quickly summarize. So why we do all these is because for China, the industry, we think the Chinese government is chasing for the universal health care. That means if you are Chinese citizens, you definitely will be treated by government and probably by free. That is the direction. But that means you have to wait you have to be to go to some specific places that is appointed by the government. So if you just want to be treated this afternoon, and if you want to go to some better environment and better places, then you have to go to the private system. That is already the direction, and in a lot of places we already have seen these policies being opened. So for this, we think there's still 4 different industries. It definitely has strong values. For the pharmacists, they still have a lot of things can do, of course. For the insurance, definitely that's a large market, and we wanted the insurance to be grow, and we now collaborated with all the healthcare insurance companies, try to collaborate with each other, help to make the market grow. And now for the big private hospital, it definitely has the important value, because the people wanted a better environment. But what we are focusing, but 2 days they're working outside, and these 2 days they can make much money they want, that suit with the government policy and suit with what the doctor needs. And based on this, industry analysis, we have built up the Chinese version family doctor system through our platform. It was more like we are using our family doctor becoming the portal, because we have different business. They are probably from the traffic portal for the community center, for the internet hospital, for the corporate clinics, for the government collaboration, community medical center, etc. So these are general traffic. This traffic goes to our family doctor, and these family doctor, they can becoming the real guidance person. They are more like a super salesman. They actually know what the customer, what the patients they need, and then they sell the proper service from our platform to them. That is our business model. We call them the Chinese version family doctor. No, the government still have their version. They try to help the entire population, but now we try to make the family doctor actually useful. They can try to acknowledge all the diseases, what the patients they have, and acknowledge all the service we have. They link with each other, they match with each other. So that's a key here. And these are all the family doctor we have. These are our employees. And then from the doctor and the doctor group's point of view, we are building up the online and offline medical practice solutions. So for the online part, the Taobao side, and for the offline, we are the medical reward. So that is what we have done. So we can providing to all the doctors the before diagnosis, in diagnosis and treatment, and after treatment for the entire solutions they can have. That is what we have already done. And also to the healthcare industry companies. So now we are more like a platform. On our platform, we have 450,000 physicians. We have around 20 million patients. We also have a lot of we also have over 100 medical centers we own, and we also linked with 30,000 hospitals and also something else. So we just link with this, and then we have insurance companies, the pharmaceutical companies. We help them to finding a better solution for what they need there. That is now the business model. So, and for the corporate for the last thing, and for the corporate clinic, we now have the serving their employee, try to find out better solutions. Just make sure that is all our helps the corporate corporates they will need. Of course, these are serving for the DD, Meituan, Mars, stores, etc. So this is our business model for the corporate side. So at last, let's just see some photos that will help you to know what the service we can provide. So this is all our day surgical centers. These are standardized. You see one, you see all. And this is our rehab hospital. This is our eye clinics. This is our dental clinics. And this is our Chinese specialist centers. This is our corporate infirmaries. And this is our community medical center collaborating with government. And this is our GP centers, GP clinics, and our insurance cooperated medical centers. Okay, so finally, I just want to summarize our vision is we're just trying to leveraging the technology, providing a high quality healthcare service, which is accessible and affordable to everyone. Okay, thank you. And if you have any questions, contact me. Yeah, thanks.
Thank you so much, Adam. Very, very impressive. You know, so many countries in the Western world, they actually struggle so much with this excessive overhead and operational inefficiencies. And it sounds like Tencent tries to, you know, go through that and create these operational efficiencies. And I think it's fantastic. So thank you so much. I think, you know, I'm very honored to be hosting this, and I see that it was a really well put together program today, because we started with the technology side of 5G, and then we talked about all this innovation that is happening. And then Adam just talked about online, offline. And now we're going to move on to the blockchain and patient, you know, the privacy issues. So I think it is a really well done programming. So now our next speaker is Dr. Martin Brelin. He's associate professor at the Chinese University of Hong Kong. For the past 18 months, Dr. Martin has been working on digital health passport using blockchain technology with a grant from the Hong Kong government. Today, Dr. Martin will share what they've done and where they will go from here, meaning how to expand such blockchain technology to other domains of healthcare. Patient information security is a very important area, and blockchain technology use may be a solution for privacy preservation. Dr. Martin is a graduate of University of Oxford, University of Cambridge, and Université Catholique de Louvain. Did I say it right? And now let us welcome Dr. Martin. Thank you.
Great. Thank you so much for the kind introduction. And let me share my screen here with you. I hope everyone can see my slides. Good. So yes, as mentioned, I'll be talking today about blockchain technology, talking a little bit about the background of the technology itself and how we can use that within healthcare, and show you a little bit about what we've built so far in the very short space of time that we've been involved with this tech. Blockchain technology is an evolving field that's developing extremely rapidly, and whereas many of you might believe that the tech is limited to those areas of blockchain which have become very popular in the last few years, like cryptocurrencies and online decentralized finance and non-fungible tokens, which are now being used for digital art, for example, there is another blockchain solution which is run by industries, which is referred to as enterprise blockchain. And this is a field that's been predominantly being used by the finance sector, building things like CBDCs, so centralized bank digital currencies, cross-border remittances platforms, as well as supply chain management solutions for all sorts of products, whether it be food, fine wine, or drug pharmaceuticals. And enterprise blockchain is certainly making a lot of progress in the last few years within the healthcare sector. And I say it's a relatively new technology because really the first documentation of blockchain technology was only back in 2008, when the anonymous developer or even group of developers who go by the name of Satoshi Nakamoto published this cardinal paper, which is entitled Bitcoin, a peer-to-peer electronic cash system. And they were motivated at the time to build this solution for finance based on the financial crisis that was ongoing in 2008, with the aim of decentralizing finance, so allowing people to take self-sovereignty of their own store of wealth and to transfer that wealth in an entirely peer-to-peer manner. And this was by no means the first attempt at creating a peer-to-peer payment infrastructure. The Bitcoin solved a very important problem, which was something called concurrency control, which is basically how do we serialize transactions to avoid something called the double spend. So in other words, how do we stop one transaction being recorded multiple times on the blockchain? And this was solved using a very ingenious consensus algorithm, which we call the proof of work algorithm. But essentially, one individual on the network is chosen to be the person to append the next transaction onto the ledger. Those transactions are bundled into blocks. Those blocks are cryptographically hashed and then added onto the previous block in the chain, and hence the terminology of blockchain. And blockchain has really evolved at breakneck speed. The first iteration of blockchain, namely Bitcoin, was really just a blockchain that allowed us to keep a store of value and to move that store of value between different peers on the network. Since then, we've had the advent of smart contracts, which was introduced by the Ethereum network. And now there are many other smart contract platforms like Cardano, Solana, Polkadot, and so forth. And they've allowed us to expand the utility of blockchain, allowing us to run autonomous pieces of code on top of the blockchain, which will execute when certain conditions are met. And the blockchain field is emerging very rapidly. It's beginning to merge itself together with AI, such that many early pioneers are envisioning a type of World Wide Web, which is referred to as Web 3.0, soon becoming available, which would be an entirely decentralized, blockchain-based, AI-integrated, ubiquitous version of the internet, which of course is going to form the backbone of the metaverse, which has also been popularized recently in the media. Before I show you a little bit about what we've built, there are a few core features that I think are worth emphasizing about blockchain technology and why they're so useful for healthcare. The first and core feature, of course, is the decentralization aspect. So you're essentially removing the need for a centralized party to keep ownership, share and protect individuals' private health information, as well as even their private identities. So by removing a centralized authority and distributing this data on a ledger, which is carried or stored rather in a set of nodes, you can essentially get rid of any one individual needing to keep ownership of the data. And these nodes keep an updated version of the ledger, such that if any one particular node has an update of the ledger, all other nodes are automatically updated. If one node rather should go down for any reason, there might be an outage, there might be a problem with the node, there might be a hacking of the node, then this node can go down, but the other nodes on the network can keep the security. And when that node is back up and running again, it can just be updated automatically. These nodes are operated in two broad categories, which we call public and private blockchains, and people integrate on these platforms in either a permissioned or permissionless manner, which is a little bit beyond perhaps the scope of today's talk. What's important to know, though, is that the data on the blockchain is validated and immutable. So immutability simply means that once the data is written onto the blockchain, it's impossible to change it. So it's stored there forever. It's cryptographically hashed onto the blockchain, so there's no way that people can tamper with the data after it's been written there. And the data is validated through the consensus mechanism that we spoke about briefly. And these consensus mechanisms, again, are quite complicated and they're evolving day by day, but essentially we're moving away from the old style proof of work into more modern consensus algorithms like proof of stake, and in private blockchains, consensus mechanisms like the proof of authority are quite widely used. And each transaction onto the blockchain is timestamped. So the exact time and date of each entry onto the blockchain is recorded, which means that all of the entries on the ledger are auditable and traceable. And for healthcare, the importance here is that for the first time, patients can take self-sovereignty and ownership of all of their data. And they can choose to share that data with other healthcare providers, whether they be doctors, nurses, or healthcare authorities, in an entirely consented manner. And that data sharing doesn't need to pass through a centralized authority. So they can share that data in an entirely peer-to-peer manner. So the sharing is at the discretion of the individual patient, and the sharing occurs on a consensual basis. And the revoking of access is also controlled by the patient. The sharing can even be further improved with a protocol known as zero-knowledge proof, which allows people to selectively share the minimum data set that they wish to share with another party. And as I mentioned previously, the implementation of smart contracts on top of the blockchain has now allowed us to automate many of the interactions between doctors and patients on a blockchain. These smart contracts are open, transparent, they're auditable. People can go in and approve the contracts before they begin to interact with healthcare providers on our blockchain solution. And blockchain has become such a big topic now during the pandemic, as it's been widely debated as to whether we need to use blockchain technology to keep COVID credentials private and under self-sovereignty of individuals. By COVID credentials, I mean your vaccination status, your COVID-19 test results, as well as perhaps your immunity, so your antibody blood levels on a passport. These COVID-19 passports have caused quite a lot of controversy and debate, as I'm sure you're all aware. There are some people who believe strongly that they are the way forward, that they provide security and they provide a safe means by which we can protect ourselves and the people around us. Others feel very strongly that these solutions are not going to bring us closer to settling into a new normal. My personal feeling is that they are useful, provided that they are privacy preserving and provided that I can have control of my own data. So one of the things that we do agree on, and one of the things that we do know, is that paper-based vaccine certificates are probably not the way forward. Since these can be easily forged, there are certainly plenty of versions of fake vaccine certificates out there. And digital versions are no doubt the way forward. I was recently interviewed for a Vietnamese newspaper to talk about how public key infrastructure and cryptographic signatures allow us to authenticate vaccine certificates and reduce, most likely, the number of fake vaccine certificates that are in circulation. But we have a problem right now that everyone's developed their own digital health passports. They're not interoperable. Not all of them are decentralized. Some of them are still dependent on centralized storage, which has safety and privacy concerns. So approximately a year to 18 months ago, we set about developing our own blockchain-based COVID-19 passport solution, which we referred to as Medoxi. The aim of this passport was to keep verifiable data immutably stored in a decentralized manner on a blockchain. And for each individual who signs up with a passport to have a privacy preserving feature known as a decentralized identifier. What this means is that once they are verified that they are who they say they are, then all of their identity data is stored on the blockchain. And they can choose to share their identity and their private health information themselves, because they maintain self-sovereignty of that data. And they can choose how much of the data to share through the protocol of zero-knowledge proof. And when the data is shared, the person or health authority that wrote the data onto the blockchain is publicly available. So in other words, the person or authority that takes responsibility for the data to be true and correct is visible for everyone to see. And this creates a degree of trustworthiness and authenticity to the data that's stored on chain. So this is quite a big project, and I'm very lucky and ably supported by a large team of other research professors at the Chinese University of Hong Kong. We have research professors who are specialists in managing patients with COVID-19. We have other research professors who are in the field of public health medicine. Also, we're supported by the computer science department and information engineering department. So we have a fairly big team at the university leading this project. And we're very lucky to be working with one of the industry great giants in blockchain technology, that is namely Consensus. For those of you who may be aware of blockchain technology or who may have worked in the fintech sector, you'll no doubt be aware of who Consensus are. They are the global leading enterprise Ethereum blockchain development company. They've got a track record of building CBDCs, cross-border remittance solution platforms. They build the blockchain for all the big banks. And I simply came to them just over a year ago and asked them to take the same security and protocols that they have in place already for their enterprise blockchain solutions in fintech sector and simply transplant it into a healthcare application. And it's been a tremendous pleasure to see us working so quickly on developing this product, thanks to Consensus's help. So the product itself is really quite straightforward. We can keep 4 COVID-19 credential data on the passports. There's COVID-19 test results, vaccination status, antibody test, and any kind of metadata relating to your COVID-19 credentials. So you can store, for example, certificates that you've recovered from COVID-19, your body temperature check, or any kind of questionnaires as self-certifications. And the sharing of this data, as a doctor who sees patients every day, I take consent on a daily basis from patients. So I felt it was very important to build a consent process into the application. So we have a process of informed consent that the patients need to go through before they're able to display their QR code and share their private health information. The scanning of a passport is very straightforward. The requester simply scans the QR code of the passport where they wish to obtain information from. Within that, encrypted is the COVID-19 credentials data. And the passport then takes that data, hashes it, and then compares it to the records on the blockchain to then validate the timestamp of when that data was recorded onto the blockchain, and also checks the cryptographic signatures to check the authenticity of the data that was written onto the passport. This concept of open authorship we felt was very important, and it provides the trustworthiness of ensuring that the data is true and correct. And over the last 6 months, we've been fortunate enough to have the support from the Hong Kong government, and more specifically from a department called the Office of the Government Chief Information Officer, helping us to implement a QR code scanning system, which is currently available on the paper-based certificates here in Hong Kong. So no longer do people have to manually input their data, rather they can scan the QR code that's available on the paper-based certificates, within which is a cryptographic key that we can verify with the government databases. And if it's true and correct, and if the data matches the data of the passport in terms of the decentralized identifier, then the data can be automatically uploaded onto our blockchain solution. So we're very grateful and thankful to the OGCIO for the encouragement and support that they've been providing so far in the development of our COVID-19 passport solution. This video simply shows a manual entry of a COVID-19 data. On the right-hand side, you can see the healthcare professional entering a COVID-19 test result. We can choose the type of test, the timing of the test, what type of sample was taken, and of course, what the test result is. And once that data is uploaded, the cryptographic signature of that healthcare professional remains as an open authorship. And what you can see on the left side is our blockchain explorer, and you can see a transaction going through on our blockchain once the data has been uploaded. So quite recently, we tested this in a sort of beta test form in a clinical trial at our newly opened hospital at the university campus, which is called the CUHK Medical Center. This hospital is less than a year old, and within that hospital, we have a community vaccination center. So we obtained approval for this clinical trial from Institutional Review Board and the Department of Health here in Hong Kong to test the application. And we asked a few hundred participants to try the application. On the back end, we were able to stress test the application. We performed various penetration tests. We audited the smart contracts. We made sure that the system was robust. We also tested to see if whether we were able to maliciously obtain data from patients that hadn't given their consent. And of course, this was impossible to do. But on the front end, we obtained some quite useful feedback from the people that participated in the clinical trial. And one of the interesting features here in Hong Kong, which may be different to other countries, is that there's generally a very supportive stance on the use of COVID-19 passports, with many people feeling that this is a good idea and that these provide us with the ability to return society to a new normal as quickly as possible. In terms of the features of the passport, maintaining privacy and self-sovereignty of data ranked very high. And although 1/3 of the participants admitted to having extremely poor understanding of blockchain technology, once we explained the technology to them, they did feel overall that this was quite a good use case for blockchain. And the selective sharing of data was also ranked very high. They felt this was a nice feature to have. Since then, since the release 1, we've had a number of news articles that have been published on our solution, and there are more articles published. We also have scientific papers now being submitted on this innovative solution for a COVID-19 passport. And we're really now looking at launching the second release of the passport towards the end of this month, which, as I mentioned earlier, will have the self-scanning feature, as well as the implementation eventually of the decentralized identifier system into the finalized product. But looking forwards to what we can do with this in the future, if I'm honest, it started as a research project led by myself at the Faculty of Medicine at the Chinese University of Hong Kong. But we quickly realized that having built the entire infrastructure for this blockchain solution, we can quite quickly and easily implement a number of other applications on top of the same framework. The same framework is, as a broad overview shown in this slide, it has at the bottom layer the blockchain which we use, which is called Hyperledger Besu. And the middle layer has been built by Consensus, which is the API calls between the application on the top layer, layer 4, down to the blockchain. And what we build now is simply just new applications on the top layer. So our first production ready application is a COVID-19 passport, but we're looking to expand this in the future to a bigger platform that could contain all electronic patient records, for example, of a patient, which would solve this issue that we're having, particularly here in Hong Kong, where there's a public and private sector and a massive fragmentation of healthcare records. So if this could be stored on a decentralized ledger with patients taking ownership of that, that would be a nice, neat solution to this issue. We are also building supply chain tracking solutions for pharmaceutical products, as well as electronic prescriptions. And in the future, let's hope that the projects can progress into other domains like academia, where clinical trials is one big area that people are talking about blockchain having a very big disruptive effect, as well as insurance, of course. And driving this requires some very important governance frameworks. And even for that, blockchain has a solution, and these are called DAOs, or decentralized autonomous organizations. So we're looking at, even at this early stage, perhaps the implementation of a Medoxi DAO at this very early stage of our startup to get a good governance structure onto how we build future products. But this is an evolving space, and there's certainly a lot of players already building a lot of different blockchain solutions within healthcare. We're by no means alone in this field, and we're by no means the only people who see the huge benefits that blockchain technology have within the healthcare sector. But I hope in due course to be invited back to show you some of our future products and how we've been able to implement them into healthcare. But for now, I think my time is up. I would like to thank the huge team of people that support me on this project, in particular, all the university researchers and professors, and of course, a huge thanks to the huge and formidable team at Consensus, who've helped us to streamline and speed up the development progress of our blockchain healthcare products. With that, I'll leave you all of my contact details. Please feel free to get in touch. I'm also on LinkedIn, so feel free to connect. And I hope to connect with many of you and tell you more about our exciting developments in the field of blockchain technology. Thank you for your time and attention.
Thank you, Dr. Martin. That was fantastic, and that's the end of our morning session. We are going to take 1.5 hour and a half a break, and the afternoon session will start at 1:30, and it will be hosted by Martin, who is sitting in Germany. So please stay with us or come back in 1.5 hours time. Thank you. Bye-bye.
Okay, do we start? Yes, we do start. Good afternoon China and Asia. Good morning to Europe, Middle East and Africa. Good evening to the Americas. This is indeed our last section of our 2 days conference, Future First conference here at Medical Fair China. My name is Mark Richter. As you can hear from my accent, I'm from Germany, saying hello from Germany this morning. Let me quickly introduce you to Future First for those of you who didn't join us earlier. So let me share my charts. Okay. Future Files is a global society which aims to drive digital health. If you want to follow us here in China, just scan the WeChat code. If you are more familiar with LinkedIn, scan this one, and you get the latest information about Future Files. We have one common goal since 5 years now, since its inauguration. Future Health is born and raised out of the Medica and Medical Fair China family. And we aim to create a global innovation healthcare ecosystem. And that means that we kind of try to connect the health tech and med tech world with the startups and VCs and accelerators jungle. Health tech nowadays, or digital health or biotech, whatever you say, is meaning everything in tech and health. So we look into mobile, we look into IoT, data, AI, all kind of technologies which kind of helps to improve the patient's experience. And that's our mission. Globally, we are a bunch of ambassadors. One of them you will meet later on, David Lee. If startups come to us and are part of the family, they are, of course, also getting access to those global experts. You can't do such a show without strong partners, and our premium partner for this 2 days conference is HealthCare Dialogs. They are born in China. Shout out to Jonathan Hakim and his team. Meanwhile, they are a global influential group of experts in the healthcare tech ecosystem. And they helped us also to get some great speakers on board. So thanks again, HealthCare Dialogs, for your great help. Of course, we have many more partners to build a 2 days conference like this. Those of you who listened yesterday already saw that we had great speakers from Johnson & Johnson and others. Those partners you see here in the middle are those who are helping us to build the ecosystem. We had a great section from Brink yesterday. sorry, from Brink we will have one. We had one this morning, but from Xnode yesterday. And so thank you again for being part of this whole story. What can you expect in the last 3-4 hours now of this conference? Of course, a deep dive again, like we did already, into digital health tech. And so without further ado, lean back, fasten your seatbelts, and we are firing up now because we're doing our second fireside chat in this conference. Please welcome with me, and of course I need to stop screen sharing now. Welcome with me, Adam Tang. He's Vice President Q Health Trusted Doctors, which is a layout of Tencent HealthCare. And Adam, I think you spoke earlier when I was still sleeping, right? So,
hi Mark. Yeah, I've shared something with the audience this morning.
Excellent. Maybe technically, can you improve the sound of Adam a little bit, so just make it a little bit higher? Oh, good. So Adam, the fireside chat. We both don't see the fire now, but the fire is burning. Just imagine it. Oh, there you see. Yeah. So fire is on.
Okay.
Imagine we both are sitting in Himalaya mountains now, or somewhere in the north of China, in a cozy chalet. We are smoking virtual cigars. We are drinking virtual cognac.
Okay.
And we do a kind of deep dive now into what you did so far. Why are you there where you are, and what's the mission of Trusted Doctors? So yeah, let's start.
Sure.
I think you are more than 12 years now in the healthcare ecosystem. So what brought you to healthcare, Adam?
I think from the main beginning, I was on the investment sector. Well, from the first job I've joined, I focused on healthcare investment from the stock market, the second market, and then I transformed myself to the first year. I mean, I directly invest in the company, and then I transformed myself into the operator. Now I'm joined with a fundamental team with the founder. Together, we founded the Q Health Trusted Doctor. I think the key why I joined the healthcare is it's a large-scale market in China, and definitely the bright future of this is it will continue grow with a very stable speed. I don't say it will like a lot of people will mention internet company these days, and even ourselves, we are being positioned, not our self definition, but being positioned as the internet healthcare company, which they always dream a very fast speed growth. But actually, after my 11 years investment, I find no, there's such a not such a thing in healthcare industry. Every company, every people here, it will be continue a line growing like this, very slow, but it will continue going up, regardless of the economic matters, because people will always get illness, will always have the need. So I think that that's point one. It's a stable growth. Point two, I think why I joined this company is like Q Health Trusted Doctor. The main beginning was they're trying to help doctors trying to make money in China. That's a very rude, but that pure fact. What do we do now here? It match with the actual problems in China now, because the doctor rate, their salary is low, which is really unfair in this market. So it's focused on a very straightforward point. And so I think the company is really trying to solve some problems. That is why I joined it. And the problem is very important in China. The third thing, I think the main idea is, I will say, we are not so the main thing, we're trying to solve problem, but we never say we try to make a big revolution of the industry. I'm not sure the revolution definition in other world or other countries, what does that mean? But in China, I say in healthcare industry, revolution is not that correct. The public healthcare ecosystem is very strong. I mean, the government is definitely leading all the service in this area. The private sector, it will be a supplement. So if you focus on try to, how should I say, try to replace the public system or try to do their job, that's not very correct. I don't think the direction is great. But if you are trying to improve the efficiency, which is also the main factor, the internet can really help. Well, I recognize this is correct. So that is why I believe in the country division and believe in the company's vision. Actually, when I was in the last job, I was in Fosun Group doing the healthcare investment. This is my last deal. I tried to.
Fosun was part of Samsung, or what's the relation to Samsung?
Oh no, Samsung was before that. I worked, I worked in Fosun Group. Fosun is a large integrated conglomerate company in China. They have,
sure.
Probably yes. You know that.
Okay.
So I worked with Fosun for like 5 years for like hospital and healthcare investment. My last deal I trying to invest into this trusted doctor company. I believe in the three main factor. And then I failed. I didn't convince my board to invest in this. Then
which is always good. Failing in life is always good, as we all know. Meanwhile, maybe because you worked for Samsung, you worked for Fosun. Tell me a little bit more before we talk about Q Health. Tell me a little bit more about the Tencent HealthCare ecosystem. Tencent is massively growing. They are 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 growing. massively going into healthcare since years now. So can you explain the audience a little bit what Tencent's strategy is in healthcare?
Well, I think that's a very large topic because Tencent itself is a very huge conglomerate company. It has a lot of different divisions, and they're doing all ways trying to improve the healthcare industry. I can only here represent like a trusted doctor, what we are believing. I think that is why Tencent acquired and invested into this company. We become the largest strategic layout of the Tencent healthcare division. I think the main purpose we are trying to do is it's very simple. We are using, as I mentioned, the vision this morning. We are trying to leverage the technology to provide a high quality service, which is accessible and affordable to everyone. So here the keywords is leveraging the technology, but we are not trying to do any revolution or doing something really new or that new. No, we are just trying to improve the efficiency, trying to reduce the cost. That is the main fundamental thing the internet.
Okay, so let's summarize for those of you who missed your presentation earlier this morning.
Sure.
What I understood so far, yeah. So you currently you're focusing on tier 1, tier 2 cities in China, rolling out kind of special clinics and integrate them with online services and lots of digital health services, and WeChat comes in and your own app comes in. So can you explain a little bit more, this Q Health ecosystem?
I think we can summarize like two parts first. So for the online part, in a very short word, we are a doctor version Taobao. You know, the Taobao is for every city owner to open a small shop on the online part. We help the doctor to open their own business online. We sell their consultation. We sell the medication. We use the online tool to just provide the doctor a platform can directly achieve their value. So that's.
Do you do a quality check before you onboard a doctor? Do they need to fulfill criteria, those doctors? So if I would be a doctor, how can I get in touch with you?
Oh, that's actually a lot of people ask that. What's your the strongest defense for your company? So how not the others can copy it to you? I think, well, I cannot do that because everybody can just to talk to a doctor and help them to use their app. So the only thing we can do is we have so-called the beginner advance. The first start advance, and we burn money in first, which means like from 5 or 6 years ago, it was the beginning of so-called digital health year. There's a lot of other competitors and us in the same year. We started this and we burned a lot of money, try to which helped the doctor to get our online now. And now, except us, we are probably have another 3 or 4. We have hundreds of thousands doctors online. We have 400.
I saw this, like 450,000 doctors.
Yes.
Unbelievable.
Yes.
Unbelievable.
Which is nowadays, if anyone try to copy that, they need to burn much more money. But
it's a real asset.
Yeah, and to the capital. I mean, to the financial.
Could you kind of compare this like Meituan going into restaurants, and if you own a restaurant, the other fast delivery companies can't go in. So if Q Health owns a doctor, it's a barrier for others.
I don't say we own this doctor. No one owns the doctor. Doctor, they own themselves. They practice in different platforms. Even the doctor on our platform, they still have the chances. They still have the solution. Probably most of them, they will have another 2 or another 3 platforms they work in the same time. It's just like a positioning the platform, how they contribute to the doctor. Some platform, they focused on the customer. Most of them, they focused on the customer side. I mean, focus on the patient side. What the patient needs. So what the patient really have the money to pay for. So they will focus on let the doctor to solve the solution such as if a patient really have a cough or have a fever, they will push the doctor really talk to the patient for 30 minutes. Because there's a lot of complaint in China. The doctor doesn't serve the patients well, the service is too poor, etc. So they use such a way to solve patient problem. But we think differently. We think the doctor really is really in China. They just do not have enough time. 2.8 million doctors serving 1.6 billion patients. That doesn't make sense, actually. So they should be busy. They have to discuss with the patient just like 1 minute, 2 minutes, which we just want to make sure that 1 minute or 2 minutes is enough. That is why we will do a lot of like a pre-diagnosis, pre-consultation, try to make sure every evidence or every test was ready there. And when the patients really talk to the doctor will, well, just get the answer, then give the answer to the patient, try to make sure the entire process is good enough. And so we focus on what the doctor needs. They need to save their time.
And you also encourage patients to do self-diagnosis? So,
well, currently we still use the public hospital most of the test result. Self-diagnosis, we hope it can develop very fast, but still nowadays is not enough. But what we really
I saw, for example, this picture of a vending machine.
Sure.
So I'm standing in front of your vending machine and press a button and get my pills, or what?
Yeah, kind of. You will get some test results, but I will say that part is still in our development stage. We hope these vending machines, these self-diagnosis machines, can really solve some automatic, can solve some like countryside matters. Like we have a box. It was not a box. It was a small house. We have a screen there. People can sit there, can use the screen touch with the doctor online, and there are some self-diagnosis machines. This we really wanted this machine can be seated in the countryside and solve them, because they don't have the fancy doctor there. They don't have some fancy equipment, but it still has a long way to go. Nowadays, I think we are in the very beginning stage, is try to establish the relationship with the doctor and their patients. As I mentioned, the doctor time is very limited. So we improve efficiency. That's step one for the doctor side. But for the patient side is we want them value this 1 or 2 minutes or maybe 5 minutes. How they value this is they need to trust the doctor. Even though they just say 5 minutes, that's good enough, which means we evaluated all the industry. The key thing is the Chinese, they don't directly call a doctor. They don't find a family doctor. They go to 3A hospital. They only go to 3A hospital. They all trust the doctor there. So we established the platform is based on a follow-up program. We help the doctor use public hospital doctor, 3A public hospital doctor, using our platform as a follow-up platform. Then establish the relationship between the patient and the doctor. Then we involve ourselves into other stages. Then we sell medication, try to treat the patient's the symptoms and the disease directly. And then we move to the offline, because we find most of the disease cannot be just treated online or just using medication. It's not enough. So we involved ourselves into the offline. We build up the day surgical center, which is, you can say, a medical version we work. We just open a small hospital.
Exactly, they look very slick. When I saw the pictures, it looks like a Starbucks coffee, Apple shop, whatever. It's really, really nice branded. Yeah, people feel comfortable from the very first second. So, in how many cities do you have those offline clinics now?
In total, now we have around like 135 different medical centers in 16 cities, from the primary care centers, then to the specialist care, I mean dental, eye clinic, etc., and then to the surgical centers. In total, we have 130 something. Yeah.
And so, if somebody, like a patient somewhere in rural China, hooked up with you online, and got a treatment, so would he then travel to that clinic?
I think it's in different scenarios. Scenario one, if it's urgent injured or case, I don't think they will find us. they probably would directly go to some public hospital because the main function is we focus on help the doctor-patient relationship management. So if the patient already using our platform and they connect with their doctors online or offline, then when they get injured or illness, they probably will think about us. So the key, I think, we are more focusing on the chronic disease management, and some like surgeries, they are more focusing on the doctor needs. What I mean is if the people just get a small injury, they directly go to a hospital. That's the normal people's choice. But if they have to do a surgery in China, it's very seriously thing. They only want to be treated by some specific doctor. That's most of the people's choice. In that case, they maybe will go to visit some doctor in the hospital, and the doctor will, the patient maybe establish some relationship. And in most of the case, the small surgeries, they need to wait in public hospital. They are not directly you can do today. So in that case, some small surgeries, they will have the chance to be taken out to our hospital to do, and directly the next day. So that is the charming thing we have established. We becoming a supplement to the public hospital system. Make sure the big hospital focus on the big disease treatment. We focus on the small surgeries. Sorry, I forget the English of the surgery name. Like take the nail of your broken leg out, which is definitely you have to do, and which is the surgery. But if you go to the public hospital, they will say, okay, that's okay, you don't need to take it out. Or if you really insist, they will say, okay, you need to wait for 3 months. And after 3 months, probably just a trainee doctor do the surgery for you. But in our case, you can directly go to our place, and you will have a vice attending doctor level, or maybe attending, or even director level doctor to treat you, and in a fair price, which the fair price is the same to the public hospital system. And the more charming thing I really want to say is, in public hospital, the trainee doctor did the surgery, which is around like 7,000 RMB. The trainee doctor will take 150. That's all. But in our system, the doctor can take half of that, like 3,500 RMB. So
what's really interesting, Adam, is that you obviously took the online to offline model of the Alibabas and JDs of this world to healthcare. Yeah? So you're really combining the e-commerce online version of health plus the physical clinics, which is really great. Yeah?
Yeah, I think it's a little bit different because Jingdong,
of course, it's the healthcare market.
Yeah, they are more like online pharmacies. We are more like the actual online hospital. That's a little bit different. Yeah.
If you look into the future, Adam, you're doing business development in your role. You're looking into what comes next. So if you take China and all the technological developments like rollout of AI and blockchain and 5G and others. So what do you see for Q Health Trusted Doctors coming to your table, and you have to integrate it as a technology?
For technology, a lot of people, like everybody in the industry, they will say about like 5G blockchain. For us, that's a little bit too advanced. I mean, 5G maybe for big public hospital, because they need to do the telemedicine for surgery, which really require good enough transportation of the image. But for us, we also do some telemedicine, etc. But we only need a small mobile phone. That's it. We do all the telemedicine through that, like a countryside doctor, just take a mobile phone. They can connect with a doctor in our online platform. They can give a second opinion or etc. Really make a guidance to the countryside doctor. That doesn't require the 5G, which also important thing is which is the low cost, because for countryside treatment, control the budget is more important than anything else. So so we say for the technology side, we wanted more nationwide internet or good digital healthcare device like coverage. That's more important. Second, basic center, we just want sure.
Yeah, I would have a question regarding your app. So is it a Q Health app or is it a mini program in WeChat?
We have two. So for the patient side, they just need to use WeChat. Using the WeChat mini app, they can touch all the service we can provide. For the because we think let the patient to download another app, which is too complicated. Now the WeChat is already, I will say it's almost like a system. It's not just an app. It's a
it's I call it the Chinese operating system on top of everything you can have, like whether it's Apple or Google or whatever, or Huawei. Yeah, WeChat is a layer on itself.
Yeah, I have the same idea with you. That is why you let the patients just using WeChat to approach our service, which is more easy and more important. And even the video, the telemedicine video contact is also possible. But for the doctor side, they have to download a separate app because they need to have different function support. A lot of we designed solutions, so they have to download an app. But everything behind that, I mean our database, every patient in our online platform, in the mini program, or the doctor in their apps, or in our offline or the medical center healthcare information system, every account, every patient, they have an ID and it's the same. They link with each other. We have the centralized database, which is really great because the patient maybe have some diagnosis with our online doctor, then the same idea, same result, and the entire process. You can review it in our offline clinic. Then the doctor really treat you there. They can review everything, every details, and then just have a very quick summarize, and they can have further treatment. So the centralized database is the unique figure we also have.
I told you earlier that I'm a brand guy, and you still confuse me with your brand because you call yourself Q Health Trusted Doctors. Your website is Doctors Work, whatever. So I think for me, you have to clean this up.
Yeah, I think there's two reasons. One is we are a company being merged and merged and merged again. Another reason is English side. We actually didn't have an official English name yet. Q Health is just a.
So what you're telling me in Chinese, it makes more sense, yeah?
Sure. To Chinese, we never. To Chinese, we are from the main beginning was the 信人医生. Then we merged with Tencent Group, so it's becoming 企鹅信人. Then this April. This year, April, we have rebrand ourselves into future. So in Chinese, it's the future doctor, 未来医生. But still in English, we choose Q Health. It's never changed. It's just brand strategies. Yeah.
Awesome.
Yeah.
Alan, this was our fireside chat. I liked it very much.
Okay, thank you, Mark, as well.
Thanks for being my guest this afternoon, and keep in touch. Enjoy the rest of the show. Yeah.
Sure.
Goodbye.
Sure, okay. Have a nice day. Bye-bye.
Bye-bye. Okay. So great insights from Q Health Trusted Doctors and Alan. Next on stage, and I'm really proud to have them with us. I'm also, I need to say that I'm biased a little bit because I'm an active mentor of SOSV and China Accelerator and MOX. Next on stage is SOSV, which is one of the global biggest and most active VCs and accelerators born out of China. Well, not born out of China. Some parts of them are born out of China. Of course, they are US based. And with me today is our two partners actually, and they have a own slot now for 1 hour. It's Qingping Ling. She does the moderation for the next hour, and Oscar saying hello, waving already. Yeah. Thanks for making this happen, guys. And Jinping, the stage is yours. We never met, although I'm a mentor, so maybe we should work on that one. Yeah, and the stage is yours. Just put yourself. The mic is still off.
Absolutely. So
can
can you hear me?
There you are. Yes, now,
wonderful.
Now I can hear you.
Thank you so much, Mark, and thank you to you for organizing this wonderful event in the Futures for Health as well. My name is Qingping Lin. I am the COO of China Accelerator and MOX, two of the startup development programs under SOSV, which is a $1.1 billion global venture fund. We have over 1,000 investments across key sectors, including hardware, software, life sciences, and decentralization and blockchain technology. Today, we're very pleased to be here with you today. We have for you a keynote address from Oscar Ramos, who is a partner at SOSV and managing director of China Accelerator and partner at MOX. And then you'll be able to meet two of our outstanding health tech startup companies. And then finally, we will bring it all together in a wonderful panel to talk about how corporates and startups work together with those two startup companies, as well as a special guest from Johnson & Johnson today to talk about why it's so important for corporates and startups to work together and how can that be best facilitated. So without further ado, I would love to get our program started today. And first up is Oscar Ramos, who is partner at SOSV and managing director of China Accelerator and partner at MOX. As an entrepreneur turned investor, Oscar invests broadly across enterprise SaaS and cross-border internet startups. In addition to investing, Oscar has led the growth of over 175 startups through China Accelerator and MOX startup development programs. Today, he'll be speaking to us about the why, what, and how of open innovation in healthcare. So without further delay, I'd like to welcome Oscar and turn it over to him.
Thank you very much, Jinping and Mark, for the nice welcome and the opportunity to be here today and share. I want to before I start sharing, I want to share that this presentation is actually very similar to a presentation that for us was very relevant. We delivered a version of this presentation 3 years ago to one of the top pharmas in the world and to the leadership team of a top pharma in the world, and that led to their understanding of why open innovation was so important, why open innovation in China was critical for their global strategy to try to stay on the top, and eventually to the launch of one of the first innovation hubs that was created in digital health in Shanghai. And since that happened, we've seen a lot of organizations realizing that was something necessary. And well, we want to share this with you today. So I'm going to start with a question, which basically this is something that is quite important. When we talk about innovation, we're always talking about these new ideas, these new initiatives, and all of these ideas at the end, they're associated to an ROI. So, and when we think about ROI, there's an element of investment and there's an element of return that we can receive from the investment. So what I would like you to think is, what is the number of ideas that you need to back at least with $100,000 to be able to create a new product line, a new business line that will generate $100 million in value for the organization? So I mean, I know that instruction is a bit difficult, but I want everybody to think. I mean, are we talking about 10 ideas? Are we talking about 100 ideas? Are we talking about 1,000 ideas? Just try to think about, okay, what is the complexity? You know? And this is the environment where all the innovation and new ideas are created. At the end of the day, whatever the number you decide, most likely is going to be a high number. And the fact is that most of these ideas that are backed, most of these projects that are backed, they will never return anything to the company. But we're not here for a short return, for a low return. We're here for a big return. That is one of the most important challenges of innovation. In the corporate world, we are used and we expect everything to work perfectly. Everything needs to be successful, because that's what most of the organizations that has established business need to do. And particularly in healthcare, we obviously don't want to take any particular risk in anything that is very critical and very important for everybody. Well, in the investment world, we call these new initiatives startups. Okay, and if we try to find information about that number, one of the best sources, one of the most reputable sources, is a database called Crunchbase. Crunchbase is probably still today the largest database of startups, where you can see information about new companies that are funded and whatever happens with those companies. If they get acquired, if they become really big, they raise more funding, etc. And the number that Crunchbase tell us, which we know is actually lower than reality, is 250. Only 1 out of 250 startups that receive $100,000 in funding will be able to generate a value that is worth $100 million. That makes you think, well, this is theoretically information coming from investors. Investors are the ones that are, as the main responsibility, searching for these opportunities. So what's going to be the reality when you look at the numbers that are led by organizations that are used to always get things right? Well, we can talk more about that later, but I wanted to share a few numbers. No? In our case, in the case of SSB, with this program development strategy that we have, we work very closely with the companies. Our numbers right now are approximately 1 out of every 10 companies that we invest becomes or is in the way of becoming a $100 million company, and 1 out of every 100 that we invest actually becomes a $1 billion company, or so-called unicorn. So that shows that, well, there's something that you can do in this process to eliminate the risk and to improve the results that you have. As Jinping said, we're a very active VC right now. We're the most active early stage investor in the world, covering actually a wide range of territory from the Americas, Europe, Asia, and now increasingly starting our investment activity also in other areas like Africa. And by the way, we are an American fund, but we are our team, the cross-border internet focusing mostly on software, is based in Shanghai. So we have presence everywhere, and our approach for investment, it is really thinking about the world as a global place. So here in China, we're investing in Chinese companies, but we're also from here investing in companies in other parts of Asia, in America, Latin America, Europe, and Africa. So we look at the world in a really global way. This is our strategy. Our strategy is to work with a lot of companies, evaluate a lot of companies, and take this funnel of innovation so we can basically spend more time in the companies that are showing that they have a better return, and they're showing that they have better performance in what they're doing. These are different brands under our umbrella, and this is how the way we focus. Then at this moment, some people will be saying, well, what is your secret? I mean, how are you able to get those numbers that outperform the average in the industry? Well, our industry is that we have a of different people, different organizations that smart team, the mentors are a very important resource that help a lot our portfolio companies when we work with them very closely. We work with multiple partners, the startups themselves that cover a lot of different types of industries. They also provide a lot of value to that ecosystem. And there's a special type of group people, no? Like we have these perks and community partners that provide access to like discounts to our companies, but increasingly we have more multinationals, more large corporates that they come to us in search for this opportunity for collaboration, and we welcome them as an opportunity to work together. So why are these companies interested in working with us now? And I say now because it used to be different 5 years ago, and recently in the last 2 years, we've seen a very different change in why they're interested in continue working with us. Well, reality, the time, the lifespan of a company in the S&P 500 index is being reduced. The cycles of innovation are changing. Who are the players that are the top in the category in the industry, and that change is because all of this innovation will make certain best practices outdated, and they will no longer become best practices. So we have all of these new players that come to the world by providing a totally new experience to solve a problem, and you have companies that they provide more accommodation without than anyone else without owning any type of real estate. Companies providing transportation, and you have companies that have very little experience in one industry, and suddenly in 20 years they become more value that historic companies that have been there forever in an industry as traditional, where things cannot fail, as the automotive industry too. So this is something that that for a long time has been making organizations think, well, we need to try to speed up. No, we need to try to change what we do. And then we have the Chinese unicorns. And the Chinese unicorns are sometimes unaware, sometimes difficult to recognize and difficult to identify. But these Chinese unicorns are doing things that are quite interesting. First of all, half of these unicorns already have international expansion plans. They are already working to take their business to other parts of the world. But what even more interesting is that a lot of these companies, they're also venturing into new industries that are not exactly the industry where they originally were founded. I think everybody knows Meituan, probably here you've heard about Meituan, and Meituan is right now present everywhere, in everything, every single organization. You'll see more and more companies coming into industries like healthcare, and they will come with a very different approach to work and develop and take new products to market. So what makes this company special? And personally, I come from a hard sciences background. I mean, I dropped out of my PhD, but I was in the scientific track, and I have ultimate respect for the technology behind. But what makes special all of these companies is not necessarily the disruptive technology that it has, and this is coming from a fund, from a VC that actually invests very heavily into deep tech, hard tech, and now tough tech technology companies with a very high percentage of founders that come from a strong research background. But you have companies like Luckin and Manner, where I mean they are traditional companies. They're traditional companies that they do things differently. Luckin is a company that doesn't need any digital transformation. Their whole process, the whole way they operate is based on basically having a digitalization end-to-end with very streamlined processes that allow them to provide value for their customers. Manner is a even more interesting case because the company last round of funding, they raised hundreds of millions of dollars, and they achieved that in less than 5 million, in less than 5 years, when we personally actually saw them studied as a very small booth next to our office where you could barely fit 2 people. And in 5 years, that deep understanding of the customer and that not assuming that what the customer wants is just a selection of what is available, but you can try different things and twist things and really find the specific that makes the specific detail that makes the offering more valuable has been quite critical. So it is not disruptive technology. What makes these companies unique, what makes these companies really special, it's not just the technology. And as I mentioned, that's coming from an investor that is very active in that space. So we obviously do understand and do actively invest in this space. It's not enough. The polo here is it's not enough. So what makes this company special is this lean startup concept. Is this idea that in case you haven't heard about this idea, I suggest you to search online for this article. This article, Why the Lean Startup Changes Everything. It's actually a relatively old article right now. It's a few years already. But this article is the most read article in the history of Harvard Business Review. So if you don't know this article, you definitely need to check and review and get familiar with this idea. But just in a simple explanation, conceptually, when we look at the launch of a new product, particularly in engineering or sciences, we look at a traditional model where we define what we want to do and we go through prototype stages until we have something that we launch. In the lean startup approach, we assume that most likely whatever we're doing is going to be wrong. because that's the reality. Remember the first number that I shared. Only 1 out of 250 companies that are launched out there, they will eventually become successful and create at least $100 million value. So if that's the reality that we have to accept, but we start everything that we do assuming that we're going to be successful, in case we're not successful, we're not going to have any space. We're not going to have any opportunity to course correct or explore changes. Well, lean startup base what they do, assuming that, well, most likely we'll be wrong, but every time we try something, we're going to be able to learn. And every time that we learn, we're going to be able to adjust. And that is the key. That simple thing that is better said than done is what is the secret behind the success of these startups. They try and experiment, and obviously they want to get it right, but they don't need to be right from the beginning. So they will explore and try to fail fast, assuming that something is not working, and then they try to succeed faster and run faster when something does work. So the idea is, well, you have your plan that looks perfect, and then reality will come, will punch you in the mouth, will change whatever you're trying to do, and from there, well, you'll need to face a reality that is slightly different. So from this point of view, traditionally there's been these approaches that corporates have to try to, well, can you build things internally? Should you partner with somebody? Should you explore buying organizations? And now increasingly, especially in the healthcare space, and I have to say that healthcare is an area where corporate venture capital investment has been actually doing a lot of bringing a lot of great value to the ecosystem, helping to understand what are the challenges and the reality of a very, very regulated space where, yeah, you have to experiment, but well, how you experiment is critical because, well, you're playing with lives and you're playing with a type of product that will require more time. So what is the problem for corporates in that space? No, why this is something that we keep talking about it, and it's something that becomes challenging. Well, the problem for corporates is, well, inside the organizations, there's an innovation funnel that will be designed to protect the company. Will be designed to protect the company to make sure, well, there's no big problem that will create any type of liability that can put at risk any part of the organization. Because remember that in a large organization, innovation is only one part of what you're doing. No, there's a very strong business that needs to be protected, and that's definitely something that we want that everybody needs to make sure that you have and you maintain. So there's no risk, but that doesn't mean you cannot innovate. No, there's different ways to do that, and that's where, well, there's a need to bring these dual mindset to work. No, you need the discipline, the knowledge of a scientist, but you also need sometimes what we call the attitude of a pirate. Be able to prototype, be able to be very creative, and be able to realize that, well, before we try, we want to do something in a scalable and repeatable and regulated way where everything it's perfectly clear. We should answer the question: is it worth doing it or not? Is it something that we need to think about? What other elements can we consider? We can have a medicine that is great, but if the medicine doesn't taste good enough, it will be more difficult if you need to get this medicine to kids. No, and that's something that that layer of not necessarily sometimes scientist element is something that is very important, and that this pirate attitude will need to bring. So from that point of view, and just to wrap up, I shared these 4 ideas a few times, which are, like, for me, quite quite open-minded for a lot of people, and these are like 4 secrets of how to run this proper open innovation. I mean, the first thing is really try to be very, very open. No, when Starbucks came to China, they sent 2 teams, and one team said, well, there's no opportunity for us in China because everybody drinks tea. And the second team came and said, like, well, there's a massive opportunity for us in China because nobody drinks tea. So how you look at the opportunity and how you frame what you can do is going to be critical to be able to achieve something. And if you don't have this can-do attitude from the beginning, that's going to be very difficult. Risks and failure is something that is out there. It's the reality of most of the innovation, but without risk, there's never going to be any type of innovation. Second thing is challenge your assumption. especially when I work with non-Chinese multinationals. I always bring that picture that makes us, a lot of people find it like funny, but it drives a conversation. No? Like you see like people not wearing diapers, and a lot of people assumption when they're actually designing go-to-market products is, well, they're not using diapers because they're very expensive. And I mean, I have 2 kids, and I have no problem paying for diapers. And the nanny, my ayi, taking care of my kids, she didn't want to use diapers. And the reason why she didn't want to use diapers is because she thought they were unhealthy. So if you build a product with the assumption that your customer is not buying the product because it's expensive, and you make it cheaper to try to make it better for your customer, but in reality, your customer cares about quality and health, by making it cheaper, you're actually making the product less attractive. So all of your assumptions not only can guide you in the wrong direction, they can actually guide you in a way that will make your business even worse than just not doing any type of localization. Same thing that is very important for me. Mobike, the share bikes companies have been a great inspiration in terms of launching and iterating. The first version of these bicycles were heavy, were slow, were very, very difficult to operate, but they were able to learn to them. They were able to learn to them, and the amount of innovation that this has brought to the bicycle industry by putting the product really fast in the market, making it evolve, making it run. And now the way we're seeing also the innovation in the business model is a key idea on how can we make things successful. And then finally, another idea for me that it's also quite eye opener is the whole concept of organic food. When the motivation that you have for different people in terms of organic food. Organic food is successful in China, and it's successful in China not because there's an interest on the top in the sustainability of things, because there's an interest on the flavor of things. There's a major concern about food safety, and organic food is understood as safe. So you'll see a very different experience in organic food shops in China, whereas in Europe, most of the times there's very little packaging. Here, everything is super packaged, and there will be a lot of packaging because, again, the motivation and the context is very different. So that's something that always need to be understood when you are trying to explore new things. And that's how a company like Manner, simply retail chain of coffee shops, have been able to grow from a small booth where you could not fit 2 people to a unicorn in less than 5 years. So the idea here is to try to leverage collaboration with the ecosystem, with startups and with other members, and move from this closed innovation model to a more open, where multiple ideas can be combined, multiple parties can provide value in this ecosystem, and this takes to what is the real problem in this case. No? When you're trying to find open innovation, the key is always to find the right partners. It's to make sure that you're working with partners that can combine, that can bring value to you, that can add a complementary skill set. So startups and corporates are interesting because even if they're trying to address the same market, they're trying to address the same challenge, they do that with a very different culture. They do that in a very, very different way. And that opportunity to bring different points of view is what sometimes creates the magic that we've seen with a number of portfolio companies. And with that, this is just the beginning. Just keep in mind that the famous hockey stick that we always talk in the startup world is not like the one in the right, is like the in the left is like the one in the right. So it's something that will take time, we'll need experimentation, but eventually, well, things will work, and returns will come. And with that, I'm gonna hand it over back to Chimping to continue with today's schedule.
Thank you so much, Oscar. Well, that gets us started on a great note. So next, what I'd like to do is introduce everybody to 2 of our great startups through China Accelerator SOSV. Our first startup today is AWB Health Tech, and I'd like to introduce Chuan de la Osere, founder and CEO. Chuan has over 20 years of experience in technology, consulting, exhibition, hospitality, and event management industries across China, Hong Kong, UK, and France. She started AWB following the unfortunate loss of her mother to lung cancer, and since then has dedicated her life to raising health awareness so that everyone can live healthier and happier lives. So without further ado, I would like to turn the microphone over to Tron.
Hello, can you hear me? Hello, hi,
yes.
Thank you very much. Thank you, Qingping, and thank you, Oscar. And this is a great platform for us to share my value and also what we are trying to achieve. So thank you very much for inviting me. I would like to share my screen, so just bear with me 1 minute. Okay. So what I'm going to share with everybody today, it's our platform called New Me. Can you see the slides? Can everybody see the slides? Yeah.
Yes, we can. It's a little bit slow, Tuan. Here's Mark. Nice meeting you again.
Oh, hi, Mark. Nice to meet you again virtually. I think it's a little bit slow, right?
Yeah.
Okay.
So if it doesn't improve, you just need to sing your presentation. Okay. But okay. I think it's there now. Let's see.
Is there now?
HealthCare Global
okay.
Challenge.
Yes. Okay. Yes, a bit slow. Okay, great. So yeah. So let's start. My company is called the AWB, a well-being company. It's been started in 2017, and our core business is to help companies to build their health and wellness for the employees. So everybody knows since 2020, we have faced a huge global challenge on healthcare, and this has brought the whole world into a pause. And with the effect, everybody has to change the way of work. So since then, everybody companies start to adopt a new way of working, like working from home and also flexible working. And also due to the restriction of traveling, many meetings has been canceled, exactly like what we are doing now, because last year, I remember 2 years ago, we were meeting face to face, and now we have to meet virtually. So this brings a lot of new challenges for companies. With this, I think most of the company has realized that healthy employees are really a very valuable business asset, even though this concept has been talked about since many, many years, but it's not until 2020, business really feel the pain about having a healthy employee to be staying at work, to keep the business continuity is so important. So now with this crossroad of the century, I think we are facing some choices. Are we going to continue using our old way of managing the health of the employees, or are we going to do something more? So this is the usual benefit, health benefit, and also the way that companies manage employees' health in the past. So the most popular one is the annual health checkup. In China, it's almost like a benchmark. Everybody has to have it. And also health insurance, and sometimes companies hold health talks and even do health days. And also a lot of companies do EAP, employees assistance programs, and also lots of different type of sports activity, and really lots of different programs, but it doesn't work. The healthcare cost and also the health checkup data is still showing that none of those efforts have been really paying off. Every year we still see the data is going up, like the blood pressure, blood cholesterol, weight problem, and others. So companies are really asking themselves what do they need to do. So this is a really opportunity that we can grasp to change the way we work. So from AWB's point of view, if we need to change, I need to help people to avoid those extreme cases like depression or even suicide, which happen. We have to manage the whole workforce, not only the extreme and the one who has already felt sick. So in order to help everybody to change, it's not that easy because everybody are in a different stage of awareness. Some of the people, they don't even have any health awareness. And some people, they are aware, but they are not yet able to take the decision to change. And some people, they are ready to change, but they don't know what to do. And some people, they are starting to take action. So in order to help the whole population in the workforce to really stay healthy and to be the most energetic and be able to perform the best, we have to change the whole spectrum of those people. We need to bring those people with no awareness to having some awareness. And then when they start to have awareness, help them to take action. And then in the end, to really help most of the people to maintain a healthy lifestyle. But it's a very long process. So that's why we created Mini platform. And it's really based on our previous experience and working with big corporations, because in China, most of the companies who work with us, they are really big multinationals. They have already making a lot of different tries, different way to help to do this better. So we have accumulated a lot of experiences, and now we have built this platform to help them to really change the health data into concrete actions. So you can see from this chart, from the beginning, all the way until individual health profile has been already been managed by a lot of health checkup companies and also third-party flex benefit company for many, many years, at least 20 years. But the missing point between this, the health checkup data and the company's program and also the intervention program that has already in place is the personal action plan. Because most of the health checkup reports only show you a bunch of words and you don't know what to do, even though you can read the word, but it's very hard, as everybody knows, it's difficult to just read the report and do what they said you to do. So AWB and our platform, Mini, is really bringing that bridge here to link the data into to the company's health care benefit, and also to link the data to the individual's actions. So through the platform, we are going to change those data into action plan, and people can follow this task and to really start to change their behaviors. So what is behind that is the data will be generated, accumulated, take into the platform with multiple ways, through their health checkup data and through their health risk assessment, or through some of the way how they use the platform, we can gather this data. And then the data will be put through an algorithm to translate into an individual health plan. And this plan are given to the individual through the platform as tasks. So when individuals finish those tasks, they can get incentivized by points. So with the company, it's the same thing, because when we are going to be able to have most of the employees' data, the company will have aggregated data as well, and then we'll be able to help the company to generate the company plan so that they know where to spend the money. So those are some of the interfaces. We combined all the companies' different effort to help employees to be healthy into one single platform. So we have all the companies' wellness events and also video bank and learning modules, and the employee can show their wellness moment at their moments, and also the sports club and also the e-shop. So all this are combined together. And also one of the most popular activity we have carried out is health challenges. So now there are many companies who are able to bring employees' awareness to a next level through those kind of health challenges. And the health challenge can be formulated in different way. It can be in different topics, and also it can be combined with different culture. So those are the samples of the tasks. When we are going to offer the employee their health plan, it's it's shown on their platform front page as tasks, so that when they complete the task, they can get points. And also, one thing we have discovered is very interesting, because previously in the old way, companies are quite conservative. They don't want their own program to be mixed with other companies, or they don't want the connection with other companies. But now we find out that companies become more open. So they are very, very keen to have this shared resources. So our platform also offer shared fitness courses and open courses and even different programs. So different company, employee from different company can join with those programs, even though they are not offered by the company. And here is some of the wellness moment sharing. And also, this is the company report, so we can generate this report for companies to understand how their programs are working. The most important for the company is also to understand their ROI, because previously when the different effort and different initiatives are carried out through different channels and platforms and vendors, it's very hard for them to generate a complete picture of how those investment has been paid off. So now through the same platform, we link everything together, and company will be able to see how those spending has been translated into concrete results. So those are the clients we are working with now at the moment. And also this is our investor. Thank you, Oscar, and thank you, Qingping, for supporting us for such a long time. Yeah, thank you very much. So my name is Chuan, and this is my chat if you want to scale it, and talk to me later to build a healthier China together. Thank you.
Thank you so much, Tran and AWB. Well, great. So now I'd like to introduce everybody to another one of our wonderful health tech companies that's in a different space. It's Mobio Interactive. And I'd like to now turn the microphone over to Dr. Bashara Saab, who is the CEO and Chief Scientist at Mobio Interactive. Before founding Mobio, Dr. Saab was principal investigator of neuroscience at the psychiatric hospital in Zurich, where he studied the molecules and brain circuits that give rise to the motivation to learn and explore. I think that's incredibly exciting. He's not only a very accomplished scientist, but he's also very committed to science outreach and mentorship. And he established the Mount Sinai Hospital Outreach Program and was the first recipient of the Canadian Institutes of Health Research Award for Mentorship. Dr. Saab has a PhD in neuroscience from the University of Toronto. And without further ado, I'd like to turn it over to Dr. Saab.
Thanks, Qingping. I'll come in and share my screen. Very much a pleasure to be here and have the opportunity to share what we're doing at Mobio Interactive. Our promise is to deliver AI-based mental health diagnostics that every patient can access. And in case people don't know what diagnostics means, this is the combination of therapy and diagnostics at the same time, which is truly the future of medicine. The leadership team at Mobio Interactive includes myself, and you've heard a little bit about me, as well as veterans from the pharmaceutical industry. For example, Chris Hall, who was in pharma and medical devices. He orchestrated Fitbit's largest global healthcare deal for $70 million with the Singapore government a few years ago. And now he's working with us. And in addition, we have Avidis Moradian and Mark Thoburn, who are experts in their respective fields in terms of leading technology development, as well as creating the therapeutic content that we deliver through our platform. As Chuang alluded to earlier, we have a great crisis facing humanity, and that's the increase in the contribution of mental illness to loss of life and loss of life quality. Relative to all other diseases, mental illness has been reducing life and life quality in increasing proportions. And the COVID-19 pandemic has exacerbated this dramatically. We know that the current standards of care around the world have serious problems. Psychotherapy is largely inaccessible to most people. Pharmacotherapy has side effects to the point where it's only really suitable in very severe cases. And self-help and wellness tools, either they're no better than placebo or they haven't even been tested. And so we know that the solution must be scalable and personalized. The solution has to be scalable because the size of the problem is enormous. We're looking at about 1 in 10 people, so 750, close to 800 million people around the globe in need of healthcare for their mental health. It also needs to be personalized because mental illnesses are extremely unique. We all know that fingerprints are able to identify individuals, but the human brain is exponentially more individualistic and unique to each person. And because of that, mental illnesses manifest in extremely unique ways, meaning that treatment needs to be personalized. And at Mobile Interactive, we've achieved this combination. We deliver our therapy through the smartphone, which basically everybody on the planet has today, and we personally require wearable based on the phone. We already have clinical validation for 3 different medical indications: generalized anxiety, chronic stress conditions, and the mental illness comorbidities that come with cancer, cancer being a very stressful diagnosis and disease. We have an expanding diagnostic platform, 7 different indications in the pipeline, and 2 of these studies, there's two of the medical diseases that we're investigating. We're also including fMRI studies on the patients to identify the mode of action, as in how does the therapy that we deliver through the phone, how is it able to affect an individual's brain and thereby lead to a cure for the disease. Very, very much cutting edge stuff here. The core differentiating factor about Mobile Interactive is a data set that we've been able to obtain. We have over 2.4 million digital biomarkers from over 25,000 people from 175 countries around the world. And what's special about this data set is that it comes from individuals who are experienced in meditation, and particularly meditation that allows them to accurately assess how they feel. So we get these accurate assessments of stress and mood in combination with selfie videos. And again, we have thousands and thousands of these and collecting more on a daily basis. And this incredible data set has allowed us to develop neural networks that can quantify brain states. So we're quantifying actually how people feel. And we've already shown that we can identify an individual's stress with over 80% accuracy using nothing more than a 30-second selfie video. And we're now pursuing FDA approval in order to use this tool as a way to officially diagnose individuals that have chronic stress conditions. The really exciting thing about being able to quantify brain states at scale is the ability to then measure each element of treatment that we deliver on the phone in real time for each individual. And then we can invent something called efficacy-driven personalization. And we've been able to show in a recent real-world triple-blind study that our algorithms that recommend content do a better job of picking content for individuals than their own self-selection. And again, we can measure this objectively. So we know that our personalization actually adds value, it adds efficacy, it adds impact, it creates better medicine for people. There are other peers in this space pushing forward in the general space of digital therapeutics, which is growing quite quickly, but we're really the only one that has this special combination and ability to adapt in an objective way. We deliver our therapy through our hospital partners. The hospitals will then prescribe OmDTX, which is our theragnostic platform through which we deliver all of our therapies. Patients, all they need to do is go to a landing page, enter in credentials to access the therapy. They download OmDTX from the phone, they enter in the same credentials, and then it automatically reconfigures in order to treat them and their specific disease, and then continues to adapt over time. We are on a path towards reimbursed digital theragnostics, so fully integrated into the healthcare economy, paid for by payers or governments around the world, prescribed by clinicians, used by patients all over. And we expect within 18 months to have our first major revenues along this, market-leading patient adoption stream. We're de-risking the approach in the meantime. And so we're working with partners, pharmaceutical companies, as well as large global payers in order to accelerate how quickly we can drive market adoption. And in the meantime, we're able to monetize in a non-regulated way our technology. And at present, we already have over 10 million policyholders in Canada and China that are either fully or partially covered to use OmDTX. We also work with a number of hospitals around the world to deliver This includes clinical trials as well as direct partnerships where we provide OmniTX as a form of adjunct therapy and therefore not in a regulated space. We have excellent advisors. We certainly cannot do this alone. Virtually everybody on our advisory board has either an MD or a PhD, of course, except for Tony Estrella, who's very much a powerhouse in the space that we are in, and he's very much a futurist. And of course, we all understand this is a huge market opportunity. $500 billion can probably be captured by companies like ours in treating mental illnesses around the world in a digital way. And our space in general of digital therapeutics is growing at over 30% every year. So this is very much a special time in history. Mental health is a global priority. Digital therapy is an accepted class of medicine. This is the first time ever. And so our mission is to provide effective and accessible healthcare for every human. And we're really gung-ho and excited to be on this journey.
Thank you, Bashara. Thank you very much for that introduction. All right, well, now what I'd like to do is move on to our panel session where we're really going to bring it all together now and talk about how startups and corporates work together. So what I'd like to do is invite back Chuan de Jose and invite Dr. Saab here to continue on. And with them, I'd like to introduce now Dr. Dan Wang from Johnson & Johnson. So with over 20 years of experience in the life sciences sector, Dr. Wang is the regional head of Johnson & Johnson Innovation Asia Pacific. She manages a portfolio of co-investments spanning all three sectors of Johnson & Johnson. Dr. Wang holds an MD and MS Science degrees from Peking University, an MBA from Goizueta Business School, and an MPH from the Rollins School of Public Health. Both those institutes are at Emory University. I'd also like to welcome back our moderator, Oscar Ramos, partner at SOSB. So take it away, Oscar.
Thank you, Chimping, and thank you, Dan, also for joining today. We've heard already a lot from the investor side and from the startup side. So I'd like to start the conversation with you. And I'd like you to share a bit. What are the motivations? What are the reasons from your own experience in leading this effort in J&J in innovation across multiple areas and multiple verticals, working with startups? What are the motivations and what are the expectations working with startups that J&J Innovation has?
Thank you, Oscar, and also thank you, Chimping, for the invitation. It's really my honor to join this very, very great panel discussion. As Chimping already introduced me, I'm the head of Johnson & Johnson Innovation Asia Pac. I have been with this role for almost 4 years and leading our Asia Pacific team to identify the most promising early stage innovations across the Asia Pacific that we can accelerate, we can partner together with startup companies to bring those innovation to benefit the patients around the globe. So Oscar, back to your question, to talk about our motivation to work with the small startups. I think as everyone in this panel, we are aware the Asia life science ecosystem is booming, is maturing due to the rising of entrepreneurship, strong support from government and the regulatory policies and the increasing venture capital investment. At the same time, the threshold for innovation continues to rise, which has an impact on the ever-increasing R&D cost. Startups and large pharmaceutical companies, large healthcare companies, we are facing the same challenge, and we are adapting ourselves to the global economic environment and the regulatory requirement to address the unmet needs. At Johnson & Johnson Innovation, we believe a great idea can come from anywhere in the world, and there's no one company can do it alone. We need partners, and also our partners need us. There is a strength at the startup side. They can be very nimble, very quickly to capture the new ideas and new trends. And of course, the big companies like Johnson & Johnson, we have all the experience to accelerate the innovation from the concept stage to a variable commercial products. The path to commercialize commercialize a product is far beyond a new idea. Thus, we see the partnership between large corporations and startup companies is a win-win strategy for both to work together to bring the more promising innovation to benefit the patients around the globe. I think that's why we embedded ourselves around the globe in the center of life science hotspots, like in Asia Pac, we're based here in Shanghai, and also Tokyo, Seoul, Hong Kong, and Singapore. So maybe I'll pause here, Oscar. I know we have only limited time.
Yeah, thank you very much, Dan, for sharing. I actually want to build a bit on what you shared, but I want to have like the perspective of the founders that have been working with corporates. So, Chuan, your product is mostly a B2B. So for you working with multinationals as clients, it's a very common practice. But on the other side, sometimes some of these organizations, they also approach you to explore opportunities for co-creation and a deeper integration of their offerings into your platform. Can you share a bit how was that experience? I mean, what are the lessons learned on your side in terms of making this co-creation a more valuable process?
Okay, thank you, Oscar. Yeah, this is a very interesting question, because we have been working with a couple of clients on co-creating some sort of package, and I haven't been able to make it a very sustainable program yet. But one of the program I think could be relevant is that with Sanofi, we have done work break exercise, and they also in order to leverage that, they want to also co-brand it. So one of their departments, they choose to co-brand it with us. So every time when the fitness coach come into the workplace to do exercise, they are wearing the T-shirt, and also the naming of that program is called that brand. So it's a brand of their own products, which helps to help the digestive health medicines. So it worked very well, because since just a few months into the program, everybody in the company knows that brand. But that's a sort of like an internal thing. So afterwards, they wanted to also work with us to roll out this program to other companies. But unfortunately, it didn't carry on. But I think it's a very good trial. And then we have some other companies who also have similar interest as well. But since we are quite small at this stage, we haven't been able to go so far into those collaborations yet. But we can see many this kind of opportunity. One of them is quite concrete, is with Adidas. So they are our client, but in the same time, they provided us a lot of content of their fitness movement. So we combine this movement into our program. So when people receive their daily fitness exercise, it's Adidas exercise. But those are the sparkling stars, and we don't know how to take it on from that point yet. But it's just some interesting thoughts. I think if we given more ideas and more budget, we will be able to bring it further. And I'm pretty sure this can create some value for big corporations.
Yeah, definitely. That's an interesting area that we're seeing a lot in terms of more awareness of the role that companies in other industries have in healthcare, when seeing like apparel brands, food brands, and not traditional health players, even cosmetic brands, trying to work on that area and looking for more collaboration. I want to now to talk a bit about with Beshara about his experience. So Beshara, you're the international startup here, but you've been working in China with different types of strategies to access the market. Can you share any of your experience working with multinationals in China, and how this has been valuable for the development of your company, development of your product?
Yeah, I mean, as you know, Oscar, in early days, we had a collaboration with Mead Johnson Nutrition, which I think was helped put together through one of the programs that China Accelerator runs in Shanghai. And what they wanted us to do was to help them increase their, I mean, it was a marketing play, really. They wanted to showcase they make baby food, right? And they make a ton of money selling baby food. China's their biggest market, but they're very much multinational. And the formula that they made, and so they wanted something that they could give to their customers, just as a gift, as a way to showcase that they were, they had their well-being at heart. And so they paid us some cash to develop a WeChat mini program, which we were then able to give out for free. And as part of the arrangement, in addition to them giving us the funding, we're also able to then use that WeChat mini program as a Trojan horse or a funnel into our digital theragnostic platform on DTX. And so that worked out really quite well and made for us, the budget, that we received from them being relatively modest, just totally fine because it covered the costs and we got additional benefits.
Thank you for sharing that specific case, Besh. Dan, I'm going to go back to you now, and I'd like to hear a bit more about your specific experience. If you could share any case that you've just is valuable, so that can illustrate for any entrepreneurs that are thinking about working in co-creation with J&J or with other players in the space, and share with us also some lessons learned from that. I think that would be really valuable for the entrepreneur audience.
Yeah, so Oscar, maybe let me explain the approaches for collaboration with the startups. Depending on where an idea is in its life cycle, our collaborators and partners can easily tap into Johnson & Johnson's broad and unique range of collaboration models, including, first of all, I think you may have heard about the early innovation collaboration and partners, connected the early stage startup company across pharmaceutical, medical device, and consumer health sector through the early innovation partnering team located in our innovation center. And secondly, we also have the JDDC, which is a corporate venture capital investment branch to provide the financial capital support to startup companies and entrepreneurs. And thirdly, we have the World Incubator Network, our G-Labs, provide the early stage innovators with access to capital efficient lab space and resources. And here in Shanghai, we have the world's largest and first in the region G-Labs at Shanghai, which has opened for more than 2 years and incubated for more than 50 companies across the different sectors. So those are the different offerings and tools that Johnson & Johnson Innovation, we collaborate with our partners, really depending on the stage and also the need from the partner. So in Asia Pac, we are proud of the strategic partnership we have across the region. There are so many great examples I can share. For example, I want to mention our recent collaboration with In Silico Medicine, which is a Hong Kong-based company specializing in AI-based drug discovery. So this collaboration, we leverage In Silico Medicine's AI-based platform to design the small molecule HIS with defined properties for several targets nominated by Janssen. The collaboration aims to generate a novel and fully patentable chemicals scaffold for targeted using the AI-based drug design, potentially leading to significant reduction in time and cost in drug discovery. So I think we have many different good examples, but the key here is we are having the very flexible partnership model. We don't want to use a universal kind of a format to work with every partners, because every partner, every startup is different and is unique. by having this full offering of all the tools, all capabilities, we have the flexibility to tailor make the partnership, the collaboration, to maximize the win-win value creation by both parties. Back to you, Oscar.
Thanks for sharing, Dan. Well, we have to wrap up the panel, but I'd like to at least have a final round where at the end of the day, what we believe, I think we all agree, is that there's a lot of value in fostering collaboration and working together, especially on this area where we're trying to solve very important human problems. I mean, the more we can collaborate, the more we can drive value for patients and make everything more accessible, the better. So what I would like us to do is a final round, starting with you, Chuan. What, in your case, I mean, from your experience, what would be the suggestions that you might have for larger organizations, for corporates, to make it easy for you to be able to co-create with them?
To make it easy. I think through my experience, the big corporation usually have a lot of different departments, and it's not very easy to know to whom to talk to. And at the beginning, because there was not too many incubators or innovation center like J&J has now. So previously it has been very hard. I think it's a great initiative from companies like J&J to start to have this type of connection portal for the startups to connect with them by starting up this kind of startup programs and the innovation program, and just to open a dialogue and to let the startup know who they can talk to. I think that's really already the best thing they can do, because when you have that, when innovative startup has something, they know we can go to that specific department or people to talk to. So it's already great, I think.
Thank you, Chuan, for that very specific suggestion or recognition of the good practices already in the market. Bishara, any thoughts on your side on how can collaboration be more productive, more valuable to be able to get more products on the market?
I think it's great that we have J&J here, because we're actually a portfolio company of JE Lab Shanghai, and that's been really helpful. So I was having lunch with a member of a clinical team in Princeton, all the way on the other side of the world, discussing a potential project. And one of the things she mentioned, she says, the individual that helped set up our NDA, by the way, that was the fastest NDA I ever signed with any company. That person came back to me and then was pushing to see what's happening next with the project. And I'm like, where is this person coming from? I think they're coming from China or something. And then I realized that behind the scenes, the JLabs people, I don't know who these wonderful people are actually aware of the deals going on and pushing for them. So like really an authentic, desire to drive innovation at the speed that a startup needs. And that's one of the things that I think is that most corporates need to understand, is that startups have limited runway. We might be broke in 6 months. And so from that perspective, things need to happen a lot more quickly than they traditionally do happen in large organizations. And one of the great things, and I think JLabs is a good example of this, but other innovations that Johnson & Johnson does, is earmarking cash. Startups don't have capital either. They don't have time, they don't have capital. You give them some capital up front, and then they've got more time as well. Then you push things along. That works really well. And so these projects that are specifically defined for what is needed makes a lot of sense. And if more large organizations were to take that model, then I think it'd be much easier for startups to work along. But I think we all know that a lot of corporates aren't truly interested in innovation, right? It's sexy, it's good, it's morale. But forward-thinking, companies that have cash to burn and really want to push forward, like J&J does, this is a strong model. So, yeah.
Thank you, Bishara. And Dan, I mean, last minute for you. Turning to the other side. What would be the quick 30-second suggestion for startups that can better collaborate? No, I mean, you seem to understand how to make them feel comfortable, but how can they make it easier for you to help them? No? How can they help you?
Yeah, I think we need to help each other. Great insight shared by the two panelists here. And also, Dr. Saab, you have great observation on the JLabs model, how we can partner much more efficient in the future. So I want to share maybe with you guys when we're assessing a new partnership in J&J, besides the strategic focus area in our company pipeline, we also ask both our potential partner and ourselves for 4 questions. So number 1 is, will this solution be transformational if it's going to work in sometime in the future? Sometimes, you know, it can take 5 to 10 years to bring an idea to market, particularly for a drug, right? The long life cycle time. So are we predicting that this will be transformational and will meet the industry needs in 10 years? So there are many fancy technologies, but we're really asking about the fundamental question: what is the unmet needs and what is a transformational solution can benefit the patients in a future time? And the second question is, what's the quality of the science behind the idea and the scientific team behind it? Are they experienced enough? Are they confident to bring their idea forward with full speed? And thirdly, is there a de-risking experiment that we can agree upon by both parties? Because innovation, there is a lot of risk, a lot of uncertainties, but we need to think as much more as we can beforehand. And finally, are the potential deal terms could be fair for both parties? There are expectations on both sides. So we have the flexible deal-making experts to make the terms work for both the startups companies and also J&J. So I hope those 4 internal debating questions can help our startup company to build their business case much stronger.
Thank you very much, Dr. Wang. And thank you to all the panelists and Oscar, our moderator, for today's really interesting and informative sessions. I hope everybody listening has learned something about the real potential for startups and corporates to work together, but also some of the challenges that we have to think about, because it's not just 2 things that go together immediately. But I hope everyone realizes that there's a lot of great opportunity out there. So on behalf of SOSV, China Accelerator and MOX, I'd like to thank all of our guests today, Dr. Dan Wang, Tran de Hosere, and Dr. Bishara Saab, and of course, Oscar Ramos. And I'd also like to thank the Future for Health Society for giving us this opportunity to share a little bit of our work here at SOSV with everybody. Thank you very much. And back to you, Mark.
Thank you, Xingping. You made my life easier. Great hosting of the session. Excellent. And thank you. Good to see Juan again and Bishara, long-time Future for Health Fellows. Good to see that they are growing under the umbrella of SOSV and also J&J. Dan, thanks for being here. We had lots of your colleagues yesterday here already. Probably heard of this, George and Sharon and others. So great session. Thank you very much, SOSV. And now to another great highlight. I'm really proud to have this topic on board, because we're now turning perspective to Africa. So with me now in the next hour are 2 fellows of Future for Health. David Lee. He is kind of one of the founder of the maker scene in China. He is based in Shenzhen. Well, he's living in Shanghai, but his office is in Shenzhen, and he's doing the Shenzhen Open Innovation Lab. David is a maker, is a nerd. He's bringing innovation to lots of aspects. But in the last years, he turned his view into Africa, and precisely speaking now, East Africa, and even more precisely saying Tanzania. Why? Because there he found kind of a brother in mind with Shaukat Ali, who runs a makerspace in Dar es Salaam called Robotech. And both of them now joined forces for building the Tanzania Open Innovation Organization. And then in the next hour, we will have this kind of topic of how Chinese medtech and African and Tanzanian startup entrepreneurship spirit is meeting. David, over to you, and I'm really looking forward to this session. You're on mute, David. You're on mute. David, you're on mute.
Sorry. Hi, Mark. Hi, everyone from SOSP. Has been a while. Thanks for Mark and Future for Health for this opportunity to present some of the work and Ali and I have been doing. It's great opportunities to look at the talents and the opportunities in Tanzania. Ali and I set up the Tanga Open Innovation Organization earlier this year. He has been on the ground organizing liaison with the governments, the stakeholders there. And Mark and I have been talking about this for quite a while. And it's great to have Ali helps to put together the section. In this section, we are going to hear what needs, what opportunities, and what talents we have from Tanzania. So I think with the long time building of the China-Tanzania relationship, there's a lot more we can do in the private sectors to connect both sides. And I hope the Tanga Open Innovation Organization is the first small step of many steps we are going to be taking in the futures. And I'll turn and introduce Ali, our founders, the guys on the ground who's doing the real work. I do most of the talking. And thanks to Ali for putting together the amazing guests and panels. Over to you, Ali.
Hi, David. Thank you so much, Mark and the team. It's nice to meet you all. Good morning from Tanzania, and I don't know if it's good afternoon on your side. Just a small introduction about myself. My name is Shaukat Ali Hussain. As David mentioned, I am the founder and technical director of Robotech Labs, which is an entity which operates as a makerspace here in Dar es Salaam, Tanzania. The idea of the space was to create innovation or a space for co-creation of innovative ideas. And the space has been providing a lot of opportunities for youth to come explore their talent and skills in bringing their prototypes to life. So without further ado, let me take you through a journey of our new project. It is called the Tanzania Open Innovation Organization. Just a second, please. Here we go. Start our presentation. Can everyone see my screen? Just to confirm. Okay. Can you see my screen, right?
Awesome. All good, all good. We can see.
Perfect. So let me take you through a small journey of the Tanzania Open Innovation Organization. And as we all know, our main objective has always been to align towards the Sustainable Development Goals. All our cooperatives, which we'll be discussing further, will be aligned towards these objectives. And our intention is that everything that is built is towards sustainability in the community. A small little introduction about us, our vision, our aim, our objectives. We are trying to create a community-led initiative where there is transfer of skills, knowledge, and expertise down to the community, and the community take up these responsibilities in ensuring that the cooperative or the project in hand that is being worked on or is being developed is scaled to its full potential and beyond. Why we chose it to be a community level is because we believe that at the end, since our objectives are aligned in community development, we also want to ensure that the community themselves are self-initiated to take up the responsibilities and lead it as their own entity. So just to give you a small update on our progress, we actually began our establishment on ground work in July 2021. The location of our establishment has been in Tanga. And the impact that we've had so far is we've been trying to ensure that the community, we're actually working with very young individuals who are actually active members in the community. and trying to engage into a variety of training programs, including education, computer literacy skills, and more. Just to highlight one point over here, and I think it's something that people should really look into most of the times, is the region Tonga. Why Tonga, and why not any other region? One of the reasons that we were given to work in Tonga, and I'm very proud that it's in Tonga, it's because the area has little to no exposure with regards to these kind of technologies. Yet the community present there and the youth present there are quite diverse and active. So we thought it would be ideal to go ahead and have the project in Tonga, in the region where there are people who actually want to, who actually lack this exposure and this experience. And having them build something from ground zero all the way to something that is tangible would be the biggest success of impact indicator for us in our project. So how does the cooperative model work? I've been talking about this cooperative model for quite some time already. The way it usually works is we engage the community with training activities, including soft and technical skill sets. We then try to establish and operate the cooperative as an entity together, which means this is co-owned by us and the community. We then deploy a sustaining and scaling model towards the establishment of the entity. And then we exit the model as members of the cooperative who actually initiate the cooperative through a mutual agreement, where the members of the community themselves step up and say, okay, now we really take up the opportunity. So with relevant guidance and support, the cooperative is then established to its own independence. Something, sorry, yeah, I think this is missing slide. Yeah, sorry. So to give an example of a cooperative model and working in place, we have one of the cooperatives we're working on called the e-mobility co-op. This is aligned towards deployment of electric vehicles, both two-wheelers and three-wheelers. And the way that it works is David and I try to create a training and mentorship program for the community of workers. The community of workers are the individuals who own and manage the cooperative. And the cooperative is sustained through a variety of means, which means you have in-house assembly, potential manufacturing of these vehicles. The initial funding comes from these credit unions or SACCO groups, which is a group of individuals who put in their money and that the money is used for the project together. At the same time, there's also an example of another platform for making enough money for themselves is a mobile app, for example. The application will allow ride sharing, delivery services, and more. And this is generally how I would define the operating of the cooperative for one case over here. Since that we are here, I would like to maybe showcase some of our work that we're trying to develop in the health sector. We also have a health or medical cooperative. Some of the things that we have been trying to work on the ground here since July, we have things like prosthetics. We've been trying to 3D print prosthetics for both upper and lower limbs. We've been developing some fetoscopes that are needed for rural settings, which are not really easily procurable. Another thing we're looking into is diagnostic tools, for example, where we're trying to see if they can actually be, excuse me just a second. Okay, yeah. We're trying to see if this actually can be deployed in these areas. I think one of the challenges that people have been facing the most recently is the ability to actually do detection and diagnostics. So one of the things that I think my colleague will be talking about was the establishment and the operation of Boxy. We also have the oxygen concentrator project. We have a few colleagues that we have been working with from India right now as we speak. We were able to develop our first mock-up of an oxygen concentrator. And our intention and hope is we can actually open source the design and allow more makers to access the designs and build the oxygen concentrator as well. We're also looking into things like non-invasive measuring tools with much more emphasis on neonatals and measuring devices, including infrared thermometers and pulse oximeters. And last but not least, I think this is a personal favorite. I don't want to be very biased on it, but something I really have a very soft corner to is assistive technology. We try to have devices or tools that can involve people with disabilities being more involved into the cooperative system as well. So no one is left out, everyone is included in the best way possible. Who are we supported by? Mr. Mashinda also, who is part of the panel today and who will be presenting very shortly after our presentation. He is the country representative for Foundation Botnar. He has been, I think, the biggest support that we've had since day one in giving us the opportunity to bring Toyo to life. And last but not least, the implementing partners. David and I are the co-founders of the Project Toyo, and we're looking forward to having more people on board and sharing our journey with us together. So thank you all. I hope I didn't bore you too much. I hope you got inspired by a little initiative that's been happening here in Tanga. And as a famous saying in Swahili, Hakuna Matata, which means no worries. I look forward to all of you joining us on board. And let's see how we can scroll this up together. So thank you so much.
Great, thank you. Thank you, Adi. Yeah, this has been, the project has been long time coming, and all help with the support from Mr. Hassan. And it's our great pleasure to have him with us. And he has experience in the health sector in Tanzania, also as the advisors to the Barna Foundation. Without further ado, we'll welcome Mr. Hassan for his presentation on how he sees as the need, the futures of the digitized healthcare development in Tanzania.
Okay, thank you very much, David, and also very happy again to join the platform together with Ali. A lot of progress has been made now in Tanga, but what my role is just to give you the overview briefly about the work which we are doing in Tanga. What we are doing is basically creating a city-level ecosystem. This is very important in Africa, and it's very different in China, whereby in China you have taken innovation up to provisional level, but innovations in Africa is mainly considered at the national level. So what we are doing is really trying to create a city ecosystem in order to improve health and well-being of young people in the city of Tanga. And the reason what we mean by well-being is not only having health, but also applying health for prevention, for prevention and promotive activities. And well-being is the component which line very well with what Ali has actually mentioned, is relating to education, skills, and entrepreneurship. And that's what we are aiming to achieve in Tanga. Our interventions are mainly focusing on education. We actually started to improve education services through provision of school materials like chairs and desks. These are main problems in our countries. And then we do also have a program to improve learning outcome to children, but there's also opportunity to test some of the digital tools to improve learning outcome. And this is mainly relating to, we don't have enough teachers, but we have advantage of having backbone, national backbone, which has reaching many parts of the country. The penetration rate is more than 90%. That is actually a need now to find how we can solve the problem of availability of devices, and also see how we can, one teacher can reach many students. We are also in the process of digitalization of health services. This is mainly from lower levels of care, and we see the potential of digital health mainly in the aspects of improving a community health worker who is actually being supported by several digital tools that will ensure access and quality of service at much lower ground. We do also have other program on agribusiness, on fisheries, and that's where we see the potential of digital tools to play some important role. We have just finished how to map the whole city of Tanga using drones, and now we are progressing now in creating some of the safety indexes, identifying using GIS now using identify other potential areas for interventions in relations to safety and also in relations to creating opportunities for entrepreneurs to come up with new services which are relating to either delivery services, and these things are not easily established, but we have mapped now Tanga. You can see that in the map. Now, if you go to the map, you can see houses, you can see streets which are being named. So those are some of the efforts which we are doing, and I'm looking forward to see how this cooperation will bring. It has a lot of potential to our system and to our place, and we think this is going to be a model for other local government to emulate in Tanzania. So thank you very much, David.
Thank you. Thank you for your great support. Coming up next, I think we have a great opportunity in Tanzania. We have a great support from people like Mr. Hassan, and nevertheless, we have excellent entrepreneurs like Ali's and our panelists. We're now getting into the panel sections. First, welcome. Thanks to all our panelists to join us. And hopefully with this three aspects, we can do this and the here in Shenzhen, in Suzhou, we can build better bridge to facilitate the cooperation between the resource here in China and the talent and entrepreneurs in Tanzania. First of all, welcome everybody to the panel. We would like to start with a show with each panelist to have a short introduction of themselves, what they do, what's their background. So I'm just going to follow the order on my screen. And so the first one, just Bahang Yasu, please.
Hey everyone, I believe good afternoon and good morning to all those joining maybe from Tanzania. My name is Farhan Yusuf, as introduced. I'm a pharmacist by profession. I have been working in the area of health logistics and pharmaceutical supply chain and public-private partnership for health. Thank you for this opportunity. Looking forward to engaging.
So next up, Mohammed.
Hello, everyone. Thank you for this invitation. Really glad to be part of this talk show. My name is Mohammed Zahir. I'm a biomedical scientist, having done my bachelor's in biotechnology, master's in molecular biology, and PhD in medical genetics. I'm the founder of the Tanzania Human Genetics Organization. I'm also the director of research and training at Hindu Mandal Hospital and a lecturer at the Department of Hematology at Muhimbili University, where I'm conducting research on gene therapy for sickle cell disease. Thank you so much for having me.
Great. Next one. Esa, would you like to take the next one?
Sure. Hi, everyone. My name is Isa Muhammad Ali. I'm a scientist by profession. I focused on artificial intelligence strategy and development in developing countries, and I'm the founder of the Tanzania AI Lab and community. And I'm looking forward to the discussion and potential collaborations.
Great, thank you. Next up, Gautam.
Hi, everyone. Good morning and good afternoon. David, I hope you're fine. Shaukat, thanks for inviting me, and I'm glad to be part of this wonderful panel. And I'm actually an entrepreneur by profession. and doctor by hobby. I actually have a couple of startups in India, and I'm working with Shaukat on Boxy. I look forward to the wonderful discussion.
Thank you. So I think the first question we're going to go around is so this Future for Health event was originally planned to be taking place in Suzhou, which is one of the main cities in China which produce medical device. Everything from measuring to things like incubator. It's a huge supply chain of goods, and I think a lot of vendors here are also very interested in exploring in the space of digital, and of course the opportunity in Africa. So I'd like to know is from the work, how do you think the ecosystem like this we have in Suzhou could help, and what kind of partner would you like to look for? So we'll go for the same order. We'll start with Faham.
Okay, thank you, David. And I think, as I mentioned in my introduction, I have been in the space of pharmaceutical supply chains for quite a few years now. And I definitely think there's a lot of opportunity for, so first of all, just a little background, in terms of supply chains in general, health supply chains especially, Tanzania has been quite an exemplary case for many countries in Africa, right? We have the electronics logistics management information system. All of our logistics are, pretty much online. It's connected. We have very good systems, and the public sector now is even embarking on using elements such as artificial intelligence to improve the supply chain. So there's a lot of progress that we have made, and Tanzania is often used by other countries within Africa as a case study as well. I call it, I think we have a bit of a curious case study in Tanzania, because usually what is seen in other countries is that the private sector usually is more advanced when it comes to technology, when it comes to supply chains and all of those elements in comparison to the public sector. But in Tanzania, it seems like that case is almost opposite, that the public sector has taken much more strides in terms of digital health systems, in terms of using data for decision making, while that culture is not so prevalent in the private sector. It's quite interesting, if I may say so. So there's definitely room. I mean, I think the private sector in Tanzania could really learn from some of the initiatives that you have there, because I'm sure, having seen this track, these discussions, and also just, from global information, I'm sure, a lot of things being done in your side of the world are quite advanced when it comes to using technology for supply chain. And there's a lot of potential for companies here to learn that, especially so on the private sector side. So I think there's definitely room for a lot of cooperation and collaboration in terms of what technologies can be used, how exactly is data being used for decision making, how can our private sector prepare themselves to use things like this, what are the cost implications and things like that. So I feel like there's a lot of learning that can happen, especially so across the private sector.
Yeah, so Mohammed, you work on the genome projects. There are a lot of interesting, I think, gene company over in China. How do you feel how do you like to see the connection build between your work, your projects, and the resource here?
Yeah, thanks for that question. Indeed, if we look at the genetic space, I think this is not just an African problem, but a global issue, whereby when you look at the need of why we need genetics, I think the medical field is going towards precision medicine. And precision medicine simply means we use the genetic information and the environment that one lives in to customize treatment for patients in whichever aspect you look at. So I think Tanzania is only the 8th country in Africa that has a national society. So the Tanzania Human Genetics Organization is a national society that works in 4 main areas. The first one is the research area, whereby we would like to have the genetic variation present in Tanzanian populations represented in the genomic databases. And that is very pertinent and important because it has applications downstream for diagnostic and therapeutic purposes. However, the challenge as far as the genetics space in Tanzania is concerned is infrastructure and human resources. I'm aware of a company in China called BGI, which is sort of sharing the monopoly with the Illumina company as far as development of next generation sequencing machines is concerned. And why do I mention next generation sequencing? Is because those are the tools that allows us to conduct massive screening of multiple genes in our DNA, so as to be able to identify mutations that could probably be the cause of a particular disease. Now, these next generation sequencing machines in itself are very important tools that we need. These are machines that we need. But at the same time, I think the product or what the machine produces are sequences that are of 100 to 1,000 of terabytes, and therefore that requires a huge computational force that is able to process that information and be able to identify with specificity where those particular mutations are present and how are they related to a particular disease. So there is a need to develop the infrastructure as far as data storage and data generation and data retrieval is concerned. So as far as what we can learn from China is how fast the genetics field in China developed in the last 15 years or so to sort of catch up with the rest of the world, especially Europe and America. And one way to see a cross-cutting collaboration between China and Tanzania in the medical field would be the genetic space, whereby not only are we sharing resources, but also knowledge on how these genetic informations can be processed and analyzed, as well as development of infrastructure from both the data generation perspective, but also data analysis perspective. The other area where the Tanzania Human Genetics Organization works is also training of individuals, because end of the day, we would like to produce more people in the field who are able to do the things that we wish for them to do in the genetics field. So you have people in the lab space, the lab technologists, we have people in the computational phase, we have the bioinformaticians, we have people in the counseling phase, because that requires genetic counseling, and we have people in the ethics space. So how can we utilize ethical, legal, social issues to address some of these genetic conditions? The other area is partnering with patient groups, so really advocacy, because once we understand or create an awareness on what types of diseases exist that are genetic in nature in Tanzania, that's when we'll be able to create a market as to where exactly we were, if we were to get funded or have these tools, where exactly we can sort of utilize those tools for better purposes in terms of diagnosis. And finally, is the space of diagnostics. So in fact, if we are able to strengthen our research, training, and advocacy components, we'll be able to offer more accurate diagnosis in this space. And that is an area that we wish to achieve in the near future, whereby genetics is not only looked at it from a research perspective, but also implicated from a routine practice in our hospitals. So that's the vision, and that's where we wish to be in the near future. And the investment has to come in the area of infrastructure for data generation, but also infrastructure for computational analysis of our data. Thank you so much.
Great, thank you. So, Esa, what would be your things of the looking for cooperation with the vendors ecosystem here?
Sure. So to start off, simply, I'll echo very similar sentiments to what Mohammed was talking about, that some of the foundational areas that we are looking to develop are going to be the infrastructure for data and computation. Because my specific area of interest is applied artificial intelligence. How do we make sure that we have more people here being able to utilize and implement the technology in different areas of interest? And part of the holdbacks there are our data and infrastructure facilities, especially because Tanzania has taken measures to be very conscious about data privacy and security. For example, in the healthcare sector, certain data is not allowed to be stored outside of national borders. It needs to be stored on national data servers or infrastructure within the country. We can't use cloud resources to compute or store certain data, especially within the healthcare line. So with limitations like that is where we need more partners who are able to support the local infrastructure development. And second to that comes to the capacity side of things. As we work to develop more capacity and awareness around the technology, a big gap that exists is skill for deployment. It's one thing to be able to develop the algorithms in small silos as prototypes, and then a whole different discussion when we come to actually deploying the algorithms in the field and being able to scale them. And that's an area in which a lot of companies in China have done very well in developing algorithms very quickly and deploying it at very large scale. And that's a big area of collaboration that we can see. So those would be the two major areas that we'd be looking to collaborate on.
Great, thank you. So Graham, we want to see your takes on the kind of cooperation moving forward we should facilitate.
What I think is from Boxy's perspective, what we mainly plan to achieve is value-based healthcare. And in times of the pandemic, we see how value-based healthcare is like very important. It generally starts from the perspective that the purpose is to help individuals and families and people all over the world achieve better access to healthcare. There are numerous countries that spend more on their per capita on healthcare system, but the access and the outcome of the system is kind of poor. So generally value-based healthcare stems from the idea that it is to identify the shared needs and common goals of a group of people where the health outcome could be better. And the collaboration, what we mainly aim to achieve is the volume and the value that the product and the many more products that are being manufactured in and around the world. So what I think is a collaboration, and with the development that we see through China and the types of talks that we've been having with the manufacturers, we think definitely this could bring us a better perspective, and we can add a lot more value to the current system.
Great, thanks. Well, now Ali, that you ask the questions.
Oh yeah, it is my honor. It's my pleasure to take this next few minutes to discuss with the team. So I decided to ask. I have a set of questions that I thought I should come up with myself personally, given my experience working with my fellow friends, my fellow brothers. And I think let's start with Gautam first. So Gautam, I think you've had experience of being to Geneva at CERN, working with Boxy, and obviously you come from a very interesting entrepreneurial background with a very funny hobby of being a medical doctor, as you mentioned. I have actually a question to ask you. And my question is, you've had the opportunity to work on Boxy. Tell us more about the journey, the scope, and the next steps forward about it, so these people can know what the idea is about Boxy and how we can work with the open supply chain in China. And then David and the whole team of present here can know more about this wonderful opportunity together.
So Boxy, in a nutshell, is a vital signs monitor. And the whole idea came because of Shaukat, me, and Dr. Mariam. We accidentally stumbled upon a Facebook post by CERN, where we had to create a prototype for a medtech hackathon, which was organized by them. And the first challenge was digital health by Global Humanitarian Lab. So we started working on it, and in one night, Shaukat and I and Mariam, we came up with an idea to create a vital signs monitor, and Shaukat put up everything together. We 3D printed a small piece, and then we created our first video pitch, and which was a very interesting thing because we. Literally 5 hours ago, we had no idea what to do, and after 5 hours, we had like a proof of concept. So we got invited, and we had to present it in front of the in front of the panel. And so Boxy is like is a vital signs monitor which we wanted to measure 5 vitals, the 5 major vitals: BP, heart rate, SpO2, temperature, and respiratory rate. So when we were working on it, we actually learned a lot than what we were hoping to, because it was not an easy market to enter inside, because the product itself, the vital signs monitor that were being manufactured globally, the cost was really high. And there was no such monitoring platforms where we can monitor the vitals remotely. And coming from having the field experience in Africa, we thought remote patient monitoring is something very, very crucial. And when we are considering remote patient monitoring, one of the 5 steps that we had come across was setup and training, how the devices are deployed into the field, the maintenance of the devices, which is a very crucial part, the connectivity, which again plays a very important role, and the technical and maintenance support. This is what we actually focused on working, and this is what we wanted Boxy to deploy into the field, and that it shouldn't, this is how Boxy stands out from the other vitals monitors. So when we made Boxy, we had like one goal in mind, that it should be deployed in each and every single village and each and every single dispensary. And even though the patients don't have access to ready medical facilities or doctors can have an effective remote patient monitoring, even if the patient is living in a village or in a dispensary. For this, one of the most important things that helped us was the software called C2MON, control and monitoring platform. And luckily, when we did win the CERN hackathon, we also got access to C2MON, which we are currently trying to incorporate into our device. So once we do get this product deployed in the field, we believe that we could make a huge difference, because not only will we be able to monitor the vitals, and will we be able to provide remote patient monitoring platforms in Africa, we also believe that we will be able to provide maintenance and technical support, even if we are not there, or even if we are not there in the field. So Boxy, we hope to launch it soon.
Awesome stuff, Gautam. Thank you so much for sharing your experience. And with David on board as well here, and Mark as well, I think we're looking for support as well with Boxy. And if you have been in touch with us about Boxy, Mr. Mshinda is also on board. We'll hear about the fabulous opportunity that we have with Boxy, and the hope of getting this beyond manufacturing into the hands of healthcare workers and practitioners in the near future. I have another question for Isa. Isa, your background is in AI, in deploying, studying, and obviously your expertise is identifying the key opportunities in the sector. So my question to you, Isa, is the application of AI in the world is actually growing, and there have been a lot of young startups, particularly in the health sector, who have been jumping in to this opportunity. What is your opinion in terms of their prospects, their potentials of applicability and scalability?
So there is quite a bit, because we're starting to see a lot of movement from the national governments to support the adoption and implementation of the technology, where to some respects the government and development partners are actually moving at a quicker pace to adopt these emerging technologies than some private companies are here. So there is a lot of potential, and we even recently saw in the latest financial year plan that there was a mention of artificial intelligence as well as blockchain technologies to be adopted, and also in the new e-health strategies that are coming out, as well as the Ministry of Health's ICT department talking about the technology. So the potential and impact are there. What we are more lacking right now is the pure technical people who are able to go in and actually develop and deploy the solutions, because a lot of people approach artificial intelligence as a very complex area of expertise and may not be readily willing to jump into it, especially because one of the major questions that comes in is, are we going to be job ready? Are there any actual opportunities to get financed as a startup or as an individual? So those are some areas of contention that we're looking at. But the potentials are there, and it's really being driven by the youth at this point in time, because we've seen open doors from the government. They're very interested to learn more about it at the minimum, and at the other side of the spectrum, really open to deploying and developing it. We've seen a lot of happening in Tanga, for example. We've seen recently there was the development of a playbook for implementing artificial intelligence in healthcare supply chains that was developed with non-government bodies as well as government participation from the Ministry of Health. So we are seeing a very bright future in that regard.
Awesome. That's amazing. So thank you so much for your experience and expertise. And we do believe you can keep engaging the community and providing us with more potential solutions that can actually be scaled into the market. For both Mohammed Zahir and Farhan Yusuf, I have a question to both, and anyone can go first if you'd like. Obviously, from your personal experiences as well, you have had a lot of observations in terms of opportunities and challenges in your field. So again, my question is, what are your current observations in terms of the opportunities, the challenges, and in the community of Tanzania with your expertise? What are the current challenges, observations, and opportunities in your sector or in Tanzania in the health and medical sector till today, up to date so far?
Farhan, would you like to go first?
Okay. So Shaukat, I think, thank you for that question. I think I would break it down into several pieces, some of which have been mentioned, but just to emphasize, right? So I don't know if I'm framing them as opportunities, challenges. I think it's really a mixed bag. But the first thing that I'd like to talk about is, what we call the enabling environment. Now, we do have a lot of, policy documents and all that, as Isa mentioned, that talk about e-health, that talk about digital health, that talk about use of all these innovative technologies, specifically when it comes to the health sector. But I think the challenge really that needs to be overcome is implementation of those policies, and also having a more structural approach, because in many of these documents you see a lot of mention of these kinds of things, which is great that we are actually incorporating all these innovative things, but I oftentimes, you don't really see the steps to how those things can be implemented. And just, I think leadership in that particular area is something that definitely needs to be strengthened. In relation to that, I think we do need stronger partnerships between, the public sector and the private sector, not just within Tanzania, but externally as well, with partners such as the organizers of this particular discussion, because I usually tell people my favorite sustainable development goal is number 17, the one that talks about partnerships, and I really think that is a driving force for us to be able to achieve all of these ambitious goals that we have. So I do think we need to strengthen partnerships quite a bit especially between the public and the private sector. In terms of, youth innovation, and Isa mentioned that, and I'm sure we've all seen a lot of work. I think a lot of the focus and again, Tanzania has made great strides in terms of just promoting innovation. We perform very well on the innovation indices as well, but I feel like a lot of focus has gone into human-centered design. How do we design products? How do we develop products? And a lot of work has been done in that, but I really personally, I find a challenge of scale. Right? I see a lot of these innovation boot camps. I see a lot of these competitions, hackathons, where youth do participate and come up with great ideas, because we've done quite a bit of work in terms of, just designing and development of products, but strengthening of scale is required. Like, how do you take that prototype to scale? How do you scale it again, both within the country, outside the country as well? How do young people take advantage of things such as the African, free trade agreement? How do we move across borders and take those innovations to other places as well? So I really think that is something that I would also want to highlight, that we need now more strength needs to be put not on development, but on scaling. So I would talk about, those three things: a strengthened enabling environment, stronger partnerships, and how do we scale initiatives.
Thank you, Farhan. That was very enlightening, and I think very well laid out. I think from my personal perspective as well, I think the biggest challenge that we are facing as innovators as well is the go-to-market strategy when it comes to actually scaling and a prototype towards the manufacturing and towards commercialization into a final applicable product. Mose, what do you think? What do you think from your perspective?
Right. So again, thank you very much for that question. To answer it from the genetics angle, from the genetics perspective, I think we have three main challenges. And I'm going to describe those three challenges and talk a little bit about the opportunities that each of those challenges will present. Number one is genetic equity. Number two is helicopter science. And number three is training opportunities. So training challenges in the education sector. So when we look at genetic equity, I think at the moment, as I mentioned, most of the genomic databases, which is basically a space where DNA sequence of populations are stored and retrieved and used for applications such as diagnosis of genetic diseases, applications such as guidance on the kind of treatment therapy that a person can benefit from, and even prevention of unnecessary medications. So I'm talking about pharmacogenomics, whereby presence of certain variations in the DNA should sort of dictate whether or not a person will benefit from a certain medication. Now, those are the potential uses of genetic data. But unfortunately, if we look at the global genomic database, 98% of the data is Caucasian-based, and 2% is colored-based, of which Africa, a continent with 55 countries and over 1 billion people, is less than 0.5% of that information. And so that means there are two things here. One is that Africans, from the research that has been already conducted, Africans have a very diverse genetic makeup. And number two, Africans have a much more number of genetic variations than the rest of the world. And that means that if the data representation of these African populations in those genomic databases is not sufficient, then unfortunately, the existing data will not be of much use for African populations, whether it is from a diagnostic point of view or whether it is from a therapeutic point of view. And therefore, it is very important to talk about genetic equity, because this is something that the field of genetics is fighting for, where we need more equality, equity in the area of genetics. And that means there's opportunity for more collaboration in the areas of genetic research. And that means, as an example, if I'm looking at cardiovascular diseases as an example, and let's say also consider cohorts from the African population so that there is a good representation of both populations as well as the rest of the world when it comes to implementation of the research, because that would have a downstream effect on diagnosis and therapy. I believe you understand where I'm going with genetic equity. Number two is helicopter science. I think Africa has been scavenged by the scientific world for a very long time. And helicopter science in brief means that we become, we meaning researchers and scientists in Africa, become glorified sample collectors. And we ship these samples out of Africa, and then we don't even know what happens to those samples, where they are processed, what is the analysis done. We simply are put in the scientific manuscripts and publications somewhere in the middle, but we have absolutely no clue what has happened to those samples, where are they stored. Neither are we informing our patients in terms of, how are we utilizing their data. And secondly, I think from the helicopter science, I think this is now time where Africans need to decide where the priority as far as investigating genetic diseases is in the country. For far long, we have been told that this is the area you should be focusing on. But I think Africans now need to wake up and say that, no, this is the area according to local expertise we need to go for. And so we need to define for ourselves where the priority should be and prevent any sort of helicopter science by ensuring that in whichever collaboration we enter, there is a component of local capacity building as far as training is concerned, but also local capacity building as far as infrastructure is concerned. That's when we will really make progress. And that is also connecting to the genetic equity point. And lastly, I think is the training and education component. If we look at Tanzania as a case study, we do not have any bachelor or master programs in genetics. We are taught as a module in some of the medical fields. So an MD will have a module or a topic or a subject on molecular biology, which will touch on genetics as a separate sub-module for just one semester. The same would apply for the nurses, the same would apply for pharmacists, and so on and so forth. I think that would not be fair to the genetics field, given the importance of genetics in the era of technological advancement that we are currently in, and that is only going to grow from this point on. So I think there needs to be more push, both from the private as well as the government sectors, because the population, the students are ready, but are our universities ready? Is the government ready to ensure that bachelor's and master's and PhD programs in the field of human genetics is implemented on a wide scale throughout Africa? And I think that those are the three areas, main areas. There are more, but those are the three main areas of challenges. And the opportunity would be to produce more sort of comprehensive curriculums so as to have these training programs, whether it is in form of short courses, whether it is in form of a degree programs as well as diplomas, so that we ensure that we need and are generating the human resource required for the genetics field in the sub areas that I previously mentioned. So those are my takes from the genetics component. Thank you.
Thanks, Mohammad Zahir. That was quite an elaborative and detailed explanation of the opportunities and challenges that you're facing in the genetic sector as well. I know we don't have much time. We have, I think, a few minutes left, maybe 3 minutes left. I would like to leave this panel open for any feedback or any other information that people would like to share or feedback per se. Dr. Mshinda is also available. David is also here. I'm here. I think we're all here. We have all worked in this. We all have had a strong engagement in the sector of health and innovation. If there's any few words that people like to give, this is the best time. We have, I think, 2-3 minutes left on the clock before Mark moves on to the next segment of the program. So yes, is there any other feedback or any other point of interest you'd like anyone to share? Dr. Mshinda, do you have any feedback for us from what you've heard so far?
Yes, I think this is a very good discussion we had. I wish we can continue with the discussion, but one important issue which has been raised on scaling up, from prototyping and scaling up. I think this is what David Lee can also make a huge contribution, because the way the Shenzhen Open Innovation Center has been established, it has also an association of industrialists who could easily take advantage of producing, moving from prototyping to scaling up production. And this is what it actually differ with other fab labs of makers in the rest of the world. Is that correct, David Lee, please?
Yes, I think in addition to what we can help on that process, it's also great for in the field. And I think Mark and I have been talking about this for a couple of years, and we finally make it happen.
We did.
This is a great step. And yeah, that next year we want 2 hours.
I guess, I don't know, Mohammed raised his hand for a final call or whatever.
Yeah, just a very small remark to sort of close my side of things. I think we should not forget that genomic medicine has a very important commercial element as well. Because if we look at the applications of genetics and genomics, this can be applied in pharmacogenomics, as I mentioned, whereby we are producing drugs that are more specific to the population, or preventing unnecessary medication to patients that we know already from the genetic makeup that will not benefit. And these medications are quite expensive. So that is a very huge commercial element, as well as economic benefits to the country. Secondly, there is an important application in the non-invasive prenatal diagnosis, whereby we are able to detect early in the pregnancy, in the first trimester, whether a person is carrying a certain mutation that will have downstream detrimental effects or fatal effects to the child. And so different kinds of decisions can be made at that area. Thirdly, is also in the prediction of genetic diseases, so that there is early intervention, and therefore the healthier we are, the more better we can commit to the economy. And lastly, I think the area of production of drugs, because, for example, in the production of the vaccines, in the production of the medications, I think it is important that genomic medicine, there is a huge investment in Africa, because clearly, without Africa reaching the level that it needs to get to, we are going to go and reach to a point of the same issue of what happened with the COVID pandemic, what is happening now with the climate change, or what is happening with the antimicrobial resistance issue. I would like to put that in the same issue, because if the developed world or the Western world goes further, it's not going to benefit the globe. Africa and the lower middle income countries need to be on the same table, so as to have a global movement which will be beneficial for the earth. Thank you.
Thank you. Very true words. And let's kind of have this as the end of the Africa or Tanzania session now. Shaukat, David, thank you very much for putting this together. Dr. Hassan, great to meet you. Say hello to Dar es Salaam or Tanga or wherever you're based.
Yes.
Isa, you looked like a perfect future for health evangelist. Your headsets on and the blue screen behind you, it really looked like almost like a DJ. So everybody, thanks a lot for this deep dive into Africa. Thanks, David, for putting this together. It took us 3 years now, so I don't wait another 3 years for making this happen. And now, finally, going to the last session of the whole 2 days of Future First conference. And I would like to ask on stage Paul Wang, a good friend of mine. Paul, are you here? Paul, yes, there he is. Paul is part of Raising Biotech, but he's also the president of the Ferryman Club, and I'm an honorable member of the Ferryman Club. I guess at least I'm part of the WeChat group. Paul, your stage. Thanks for being here.
Okay. Can I speak Chinese?
Of course. You can speak Chinese. Yeah?
Okay. I just wait many times, and I listen to many people to talk about the supply chains. So now I'm based in Shanghai. So maybe because I don't know so many people. Let me share my documents. Please wait a moment.
Sure, sure. And again, you can speak in Chinese, yeah? We agreed on this.
Yes.
If you want to.
So, okay, everyone, can you see my?
No, not yet.
No.
You need to click share screen and then
Yes,
click on the click on the PowerPoint.
Okay, share screen.
Share screen, and then if your charts are open, just click on that page where the charts are open.
Share screen.
Maybe Fiona, you can step in and talk on Chinese.
共享屏幕在下方，您把您的鼠标。
对，我现在共享了，然后
您要选您要共享的内容，它点开应该是有很多选项的。
对，很多选项。对，现在可以看到吗？Fiona 可以看到吗？
没有。您选您的那个 PPT 已经在您电脑里面打开了吗？
对呀，我这边的吧，它是这样的，先是共享，共享呢，然后它出现图片、文档、网页、书签、屏幕。
这样吧，要不我这边来共享，然后您说的时候我帮您翻页好了，好吗？
好，可以。
稍等一下。
OK。
可以看到吗？
That looks good. Perfect. So start.
Okay, everyone, can you see my PPT?
Yes, we can see. Can you move it on big screen?
Okay.
Which is on the bottom on the right.
Yes. Maybe because the time is too late. I just think Mark is tired. I maybe just 10 minutes. Okay. Let me speak Chinese. 就是我现在认为呢，目前整个 global 的 supply chain system 呢，全球的供应链体系正在遭受个巨大的一个破坏。大家知道，目前新冠疫情，然后各个地方的自然灾害，去全球化、货币大宽松引起了很多的成本的上升，能源的危机，产业链的断裂，人口老龄化，还有很多年轻人就业意愿的降低。生态价值的重估，主要是碳成本呢大幅提高，平民阶层呢反精英意识的崛起，贸易战等等，越来越多的不可控的因素，正在对全球的供应链体系形成史无前例的威胁和巨大的实质性的破坏。那我认为呢，目前是到重构这个供应链体系的时候，因为目前呢，大家知道美国在持续的通货膨胀，9月份 CPI。核心 CPI 分别是5.4%跟4%，30年历史上的新高。然后呢，在持续的货币这个补贴下呢，大量就业人群退出劳动力市场，上千万职位空缺，供给缺口，就进一步呢加剧了通胀压力。那么现在呢，中国呢就成为一个唯一的一个大国，将国内很多的美国国内很多的日常生活用品过度依赖中国的境地，但是呢，美国呢作为一个原本崇尚标本自由主义的国家呢，其实又转入人为的干预，就是它其实在进行计划经济。为什么这么说呢？你看疫情期间直接给个人发钱，最后施舍人。就美国其实现在做计划经济式干预，这样计划经济式干预的结果就是说，越来越多的美国人就是躺在那个国家福利的温床上，退出劳动力市场。 造成美国劳动力呢供应链体系啊严重扭曲和破坏。那么中国呢，因为这个它的疫情呢控制比较好，所以呢很多国家呢在全球寻找价值洼地、物美价廉的产品供给。那么中国制造呢是这场全球化盛宴最重要的成果。它呢史无前例的把中国10亿劳动力推入了国际市场，向全球提供各种各样的生活物资和用品，形成了全球几十年无通胀增长的黄金时代。但是呢，这样的一个全球化体系呢，也存在较大的结构性问题，是一个严重失衡的供应链和贸易收支体系。一方面呢，中国储蓄生产，美国借债消费，这样的国际供需格局呢，导致长期的一个国际的收支的失衡。然后美国本土的蓝领工人呢，大家知道铁锈州、底特律啊，很多地方就成为全球化的受损者，这样也为中美贸易战和中美关系大变局呢就埋下了伏笔。另一方面呢，全球的重工业生产啊转移到中国，将最大的碳消耗也转移到了中国。2018年中国碳排放呢接近全球的1/3。那么这样又为今天的围绕碳排放权进行了国际博弈埋下了伏笔。这是我在说那个我对全球供应链的一个思考啊，以供大家那个参考。那么在疫情发生后呢，全球这个贸易体系的失衡程度呢，供应链的脆弱度呢，又得到了极限的发展。那么现在的供应链体系呢，我觉得已经到了一个危险的处境。首先呢，疫情后，中国先控制住了疫情，快速发展了生产大部分的制造产业链，这样呢，中国就成为全球物资的唯一的大型生产基地。其他国家呢没有这么幸运，陷入疫情反复和经济社会动荡的一个泥沼了。那么欧美各国呢没办法，只能印钱，别的机器停止运转，那么他们国内的这供应链体系呢就严重的停止。所以呢就出现什么情况呢？就疫情最严重的时候呢，全球都在印钞，开动那个印钞机马力在印钱，只有中国在生产。9月份中国的出口额超过了创纪录的3000亿美元，造成什么局面呢？形成了100年一遇的单向贸易，就集装箱我运到欧美去，回来就是空箱，造成很多时呢一箱难求。这运费呢1年时间涨了3倍，原来2600美金可能涨到那个28000美金一个箱子。然后呢，这样结果呢，就是中国出口创造历史记录，中美之间贸易失衡呢变得更加严重。第二个呢，就是能源危机。能源危机的原因呢，一个是天灾，各种各样的天气啊，对非石化新能源供应造成极大的破坏。那么储能体系呢无法应对风电、水电等绿色能源在极端天气情况下的不稳定性。第二个呢是人祸。那么在新能源革命下，大家知道现在很多用那个电力车，对吧？传统能源体系根本之处严重不足。然后呢，还有一些国家呢，也有国家，比如说英国脱欧。英国脱欧呢，英国找不到卡车司机来运油，全国各地的加油站加油紧张。然后呢，各个地方的电价啊越来越多，比如说西班牙、葡萄牙，9月初平均价格是半年前平均价格的3倍，每兆瓦时175欧元。那么还有一个呢，是货币发行体系扭曲，造成全球供给体系破坏的另一个重要原因。所以这种情况下呢，我们回到我们的医疗产业。那么医疗产业的数字化需求，我们应该怎么来做呢？那么简单来说呢，对医疗产业，尤其在中国，我们基本上就是几个方面，一个是要求订单协同，第二个呢，供应商的绩效，第三个呢，询价的管理。 那么目前呢，很多的那个公司，尤其在中国的医疗企业，其实跟国际上呢还相差很大的距离。他们都是些初创企业，就是分头投了他们钱。那么很多人呢，原来曾经大的公司，尤其是外资公司，可能回来独立创业。大家知道，中国这几十年创业环境还是不错，中国政府也给予很多的支持。但是呢，这样造成创业的人呢，很多都是一些技术人员，可能就是刚开始5、6个人组成一个项目组，后来呢慢慢发展到20到30个人的那个类似于相当于一个作坊，慢慢再发展成那个50到100个人。所以呢，他们呢目前呢是偏重于操作层面。操作层面呢，少数公司呢对采购技术层面有着需求，比如说如何找对供应商、管理供应商。目前为止还没有看到战略层面需求说出来解决方案的需求。那么我参加过很多的研发项目的会议，很多项目经理呢，对他们来说最痛苦的情况呢，在 sourcing， 寻找合适的供应商，提供合适的解决方案，往往花了很多精力时间在找寻供应商，跟供应商之间的交流。哎，你这个什么样电机，什么样树脂材料，去帮我来做。所以呢，那个刚开始目前阶段呢，他们往往还是在做 copy。欧美的这个医疗器械是怎么做的？他们是哪些供应商？我们也寻找什么供应商？但是目前这个局面呢，就是说供应链体系呢已经严重失衡，中美之间、中欧之间，这个订单的交期时间越来越长，价格也越来越贵，所以呢，要迫使中国医疗企业在寻找国产的供应商。那么回到基本的那个医疗企业数字化需求呢，他们最主要的一个就是订单的协同。那么就订单协同呢，包括计划的变更、订单的确认、订单的发货、订单收货、订单对账订单预测，还有一些是委外加工。中国呢，就是医疗体系改革，就现在实行2票制，就是我研发人员我专做研发，我的生产制造我可以委外，委托别人做 OEM 做 ODM。所以呢，他研发出来一个产品以后呢，他会交给别的生产厂商去生产，这样呢就会有一个供应商的管理，他要管理供应商的绩效，实现系统自动生成产生绩效报告，自动释放供应商的绩效报告。另外还有一个就是询价的管理，对供应商实现询价管理。那么这就要求数字化呢，就是供应商的在线的报价，在线发布询价，根据不同品类不同的报价的模板，然后查询它的历史价格，利用那个ERP 避免手工错误，提高效率，包括就是物流价格参数，还有招投标，还有那个相应的一些数据库。Fiona next page。那么回到根本呢，就是很多公司，尤其医疗器械行业，他们数字化转型的驱动力是什么呢？那我们来看看。那么以往呢，中国的很多的企业呢，他们都是同质化竞争比较激烈，尤其在机加工行业，中国10几来年的那个盛宴呢，造成很多粗放型的企业。老板呢心态比较复杂，哪能赚钱就哪到什么地方去。刚开始呢是家电行业，后来呢是汽车行业。汽车行业呢量比较大，那么压缩成本也压得比较厉害。很多人呢就是买设备招工人，然后呢那个图纸呢基本上都是那个上游厂家给他们的比如汽车厂家给他们的，他们就是 copy 制造。当然这也培养了一批大量供应商。那么到目前这个阶段呢，尤其是医疗行业，医疗行业呢大家都知道，小批量、多品种，然后呢因为涉及人的生命，要求特别高，所以目前这个阶段呢，已经到企业彻底转型的时候了。很多人呢就是要求提高效率，集成并洞见，就是这个数据我还要洞见， 我还要告诉我数据告诉我这个未来是什么，是数字化转型的主要驱动力。那我们分析了一下，尤其本土的公司中国的公司实施数字化转型的目的是什么？主要分为几个类，90%呢要提高工作效率，70%呢要建立大数据，60%呢就是供应商数据集成，然后预见趋势，还有呢就是要降低成本，规范流程合规，透明化决策，降低风险，然后呢淘汰人员，最后呢就产品创新。就无论企业规模大小呢，基本上都是这几个评价。那我们看看比较一个内资的一个外资的一个典型的几个企业，比如说蔚来汽车，大家看 NIO 蔚来呢很注重通过数字化帮助用户提升体验。我们去买车的时候，你就感觉整个的蔚来汽车就像一个数字座舱一样的，一进去那个蔚来里面就有一个机器人，你启动开启车窗，你都不用自己动手了，动嘴就行了。你跟他说小魏给我开车，小魏把窗子打开，小魏开空调，它会自动的来跟你说。那么施耐德公司呢，数字化转型最根本的驱动力是来源于更好的满足客户的需求。施耐德呢最近新成立了一个部门，叫智能网联部门最近招收了100多人，在中国一个新的部门。因为中国的很多工厂呢，接下来会进入一个设备管理、网络互联的时候了。然后呢，施耐德会提供很多的解决方案给这些to B 端的用户，帮他们解决数字化的问题。首先，施耐德自己要解决数字化的问题。那么，因为我自己做采购的了，所以我又回到就是说，我们采购在哪些领域实现最多的数字化？大家先可以看一下右面的这张表，我用颜色标了一下，就是黄色的、蓝色的跟绿色的。那么在医疗领域呢，最多实现呢是黄色的，目前还有很多公司其实目前还是用 Excel 表或是用钉钉钉钉是中国的一个系统，也是比较好用，适用于那个小微企业主要用于黄色的订单释放、订单确认、订单发货、对账付款、质量协同，这基本的一个就是说，因为医疗行业原来利润比较好，所以基本上呢不太考核你的那个成本降低，他只看你订单有没有满足。很多公司呢做的那个备好安全库存，推动式生产，你有没有相应的订单，有没有做到对账，质量有没有协同。那么随着这个慢慢上去了以后呢，这些呢都必须要靠数字化来实现。但是绿色这部分呢，我们目前还是很少实现。那么2019年呢，我们也做了一个数据的分析，就采购数字化的一些数据的分析，就是说60%的采购部门呢，已经连同他们的战略部门进行数字化。34%的部门呢，30%的呢是用于在一个工业这边其实所以说中国的数字化呢也是刚刚开始，下一页。那么采购数字化的远景呢，我们应该怎么做呢？我自己认为呢，要从看见、洞见到预见。就是从1.0、2.0到3.0，看见呢，就是一定要与底层的业务这个逻辑去挂钩，然后到洞见，洞见呢，我们要通过机器学习这个大数据，为客户带来价值。这当中呢，有很多供应商的材料的方案、模具的方案、机加工的方案等等等等，很多因为医疗器械行业很多也是离散制造业。分为各个模块，它呢也需要供应商提供很多集成。 最前端呢，往往是跟医生我外科手术，我需要怎样的医疗器械，他们也会想法。很多呢，也是通过外资企业，比如说手术机器人，它有很多模块，机器加工的模块、算法的模块，还有电子的模块、摄像头的模块等等等等。
Recording stopped.
也是一个非常
Recording in progress.
也是一个非常复杂的过程。那么呢，这毕竟也要靠中国的很多供应商来实现。那么这些供应商呢，整一个上下的协同，它必须要有很多解决方案来集成。另外呢，还有很多证书比如说那个 RC1092，很多的供应商的追溯性，而且协同，这必须要进行数字化。总之来说呢，在中国目前一些衰退、文明之间的冲突、地缘政治的风险等等复杂不确定因素，对全球的供应链体系造成了深层次的伤害。中国这几年呢，一直在为保护供应链体系稳定性而努力。比如说李克强总理说上游领域的供给侧结构性改革，是为了清理过剩、低效产能，提高国内供给的质量和效率。那么疫情后呢，开始构建国内外联动的双循环体系，就内循环、外循环，就是为了建立一个更加安全、更加有保障的供应链体系。在双循环体系的保障下呢，即使全球供应链因为疫情、极端天气、国际政治的不可控因素变得不稳定甚至中断，国内的供应链体系呢，仍然可以满足人们的生产生活需求。因此，双循环体系的建设重点在于建立起一套国家经济、能源、粮食和技术的安全体系。这套体系的建立呢，当然需要中国自力更生精神和国家能力加持，但是绝非闭门造车、闭关锁国和集中控制，应该以更高层次的市场化改革对外精神，竭尽全力融入到全球新的贸易和科技浪潮，并发挥出
One more minute, Paul. One more minute.
Okay.
Paul, one more minute. Yeah, one more minute. Yeah, so continue, but only 1 minute. He stops now. Paul, you can talk, but only 1 more minute.
王总，您还有1分钟，可以做一个。
好的，可以。所以呢，在目前这个情况下呢，中国的医疗体系除了国内的建立它的供应链一个循环，同时它要走出中国，要融入国际大循环当中。那么这当中呢，也有很多公司也出来了，比如说微创医疗，它的供应链的已经在全球布局，它的销售也在全球布局。这样呢，就需要各个国家的人员加入我们这边，像 FTR4 也是很好论坛 ，Mark 还有很多印度的朋友，墨西哥的朋友，南美的朋友，我们都需要。中国未来肯定会成为一个医疗器械大国。我最近在长三角走了一圈，到处都在建工厂。中国的这个生产很多的供应商，从家电的、从汽车的，都在转入医疗器械。那么一旦他们集中国家力量的加持，他们会很快的转型。所以我们组成了一个叫百度人供应链俱乐部，我们愿意带领这些国内的医疗器械融入国际的大家庭当中。他们需要在国外投资建厂，比如说在墨西哥、在加勒比海、在印度寻找新的合作伙伴，然后呢，把我们的那个医疗器械性价比比较好的医疗器械跟当地的经济联合起来，为整个全球提供更加性价比好的医疗器械的解决方案。谢谢。
Thank you, my friend. I guess these were nice words. I can't understand Chinese, but I just heard Mark and Future for Health. So thank you. Thanks for being on stage. Thanks for being on stage today as the president of the Ferryman Club. So whoever is interested in being part of the the Ferryman Club, speak to Paul. So this is the end, actually, of our 2 days Future for Health conference. We have been live on WeChat and YouTube for the past 2 days here at Medical Fair China. We saw lots of content to digest. We saw how China digital health is really ramping up and scaling up. Thanks to all the support from all those partners, the speakers, the contributors. But last but not least, Fiona, thank you for making this all possible. Thanks to the technician in the background, I don't know. So great job. And we reached an audience I just saw from over 2,500 people joining us in the last 2 days. Thank you very much. Wherever you are in the world, say bye-bye from China.
Bye-bye.
Recording stopped.